Yeah. All right, everybody. We're going to be starting in just a couple of minutes officially. Thanks for all who showed up early. Sorry for to have to close the webinar a couple of times. Just working on a couple of technical difficulties. Want everyone to make sure want to make sure the chat was open. So everyone, please type into the chat. Let us know that you're here and that you can hear me well. And let us again just know where you're from. Appreciate you all being here. My beautiful wife Tweez right here, typing into the chat. All right, we'll be getting started with the content about 5 minutes, guys. We're just going to give a chance for everybody to come in. I appreciate you all being here on a Saturday morning. Michelle from Rhode Island, very cool. I'm also from Rhode Island originally, born and raised, or uh, Coventry, from Coventry. What town in Rhode Island? New Jersey, Ontario, Warwick. Oh, right next door. Very cool. From Colorado, Gerald, Diane from Oregon. All right, loud and clear. Very cool. Thank you all for being here today, again on a Saturday. We've got a lot of things to share. We're gonna go, it said 2 hours. We may go a little longer, especially since I want to do a little bit of Q&A at the end if people are able to kind of stick around. Hopefully we don't bore you guys to death, but I find some of this information just really interesting and compelling. And there's just so much in this world of bone health. And um, of course, Audrey, I'll never forget you, Audrey. So happy that you're here too. So cool to see you here. How are you been? How's everything? From India. Oh, I appreciate you guys being here too. Again, we're just gonna give everybody a couple more minutes just to show up. We'll just hang out for a couple minutes. Audio choppy going in and out. Yeah. Um, please let me know throughout. This is our first webinar. So I apologize in advance if there are a couple of technical difficulties. The only way we really learn is through by doing. So if problems do arise, we'll be doing more. This will not be our only webinar. So although it's quite a lot of work to get these things done. So but please let us know if there are any issues with audio, visual, and we'll try to correct them. But um just want to make sure this is being recorded. It is. All right, we're going to start in about 3 or 4 minutes, guys. Yes, I'll be sharing the recording. We're going to be going long. I understand not everyone's going to be able to sit through the whole thing, because it's going to be a couple hours long. We got a lot of stuff to share. I'll be sharing it. I'll be posting it wherever I can. It's going to be available to everyone. So if you do miss it, or if you need to jump off, come back in, it'll be available for everyone. So audio. If anyone could just give me a quick check. Is the audio choppy? Does it sound okay? Joy from Danville, cool. Right down the road from us. Happy to see some local people here, but also the global people around the globe. All right, cool. Sound is okay. All right, we'll be getting started. Just a couple more minutes, guys. Thank you so much again for joining us and being here today. All right, cool. Thank you very much. Sound is good. So a couple more minutes. If you wouldn't mind all just sharing, what would be like the number one thing that you would hope to take away from today? I'd love to, again, we're going to be going over a lot of stuff. But what's the one thing that you'd be hoping to take away from this presentation, just so I can keep in the back of my mind to make sure that we can deliver on what you guys are hoping for. Safe way to work on improvement of T-score. Yep. How to avoid meds, build strong bones, prevent fractures. Yep. Reverse osteoporosis without drugs. Specific exercises for hip and femur. Yep. We'll be going over all of that. Supplements. Not my area of expertise. I'll share with you what I know. Um, Deborah says I can't hear you. I could earlier, but not now. Please let me know if audio is still an issue, guys. I want to make sure people can hear me. Just give me one more audio check if everyone can hear me. Um, if it's audio is perfect. Okay, good, good, good. Thank you so much for helping me out with some of the technical stuff. How can I start doing bone building exercise safely, advanced osteoporosis and amyloidosis inhibitor, avoiding bone meds, strength exercises after total knee, how bones as living tissue function. Yeah, we'll be going over as much as we can, guys. A lot of different people in this group, people, and we're gonna be talking about this a lot. Osteoporosis is a big, wide net of a diagnosis, and people are just coming from so many different starting points. And a lot of you guys may have seen the content we've created, and it's I find it very challenging because um, what might be good for someone who might be a little bit more advanced in terms of their overall fitness, those videos may do well for that person, but someone with more advanced stage or have been on drugs for a while, it's just going to be a completely different conversation. So that's what I'm kind of battling with right now as we try to create more content. So that's why I wanted to kind of do a longer presentation here, just so we can kind of talk through some of the differences, the nuances of a very, very clinically challenging situation we all have in front of us right now with this diagnosis and with all the available options that are out there. It's tricky, and there's no set answer, and there's going to be specific answers for specific situations, but there is no unified like everyone must do this. This option is good for everyone. That is just not true. So we're going to try our best to go over all of the specific scenarios and situations, what would be right for some and what's going to be wrong for other people. So I hope you guys can, yeah, take away something for everyone. So I think this would be a good time to start. So again, welcome everyone to our virtual workshop, Strong Bones, Strong Life. We're going to be going over safe strength training for bone health. So, my name is Dr. Kevin Mao. Uh, Together with my wife, Twee, we own a clinic here in Dublin, California, out in the East Bay called Balance and Body Restoration. And uh, thank you all for being here. Really cool. So let's get right into it. So, again, thank you all for being here. And none of this was expected at all. We're just a small little clinic in Dublin, California. Some of you guys are our clients, so you know exactly, who we are and where we're coming from. And just 2 months ago, we just started posting some couple clips from inside our walls. Um, we just wanted to share some, again, just some clips of moments we had that we thought were pretty cool and pretty inspiring. And some of our clients, again, they just graciously, let us share some of their stories with everyone. And we had no idea what was going to happen after that. And we're really just kind of playing catch up to everything that's been going on. So a full oops a full online global workshop was the last thing on my mind 3 weeks ago. It just literally didn't exist in my mind that I was going to be doing something like this. So, um, tried to put something together because of all the questions and comments that we're getting from our videos. So, here we are. So as we started posting these videos, dozens started to reach out, downloading our guides. We started getting a lot of questions through email, a lot of requests for consultations. And then hundreds started to reach out to us from around the world. And again, just started reaching out, asking questions and comments on some of the videos. And it's been a mix of where everybody's kind of coming from. Some people are scared and overwhelmed. They just got this diagnosis. They have no idea what to do about it or where to start. They feel that the information is just pulling them in so many different directions, and they just really don't have a good place to start. A lot of you, as you said, you guys are looking for alternatives. You don't want to rely upon medications. You don't want to rely upon all these things. So what can you do about it? And a lot of you seemed like you're inspired and ready to act and motivated. People are saying that they're getting motivation from seeing some of our clients exercise. They know they need to do this. They just don't have a they don't know how to do it. So so the fact that hopefully some of our content is actually inspiring people to get on this journey of, trying to build stronger bones and do it well and do it safely is really cool. And that's why I felt that we should come up here and do a full workshop just to share with you guys everything that we know, and everything that we don't know, right? Because definitely don't have all the answers. We have some, answers in terms of just which we're going to go over, just things I know, my research back when I was a student in graduate school, and just, running a clinic with my wife here for many, many years, and just kind of being in the trenches working with patients, just knowing the realities of what is possible, but also the realities of things that just may not be possible for some people. So we're going to go over all of that. So, so some of the videos, we're not trying to be provocative, but they are getting a lot of views, and trying to wrap my head around why some of these videos are just kind of getting out, and that's how you guys are here. So apparently it's doing its job and it's reaching everybody. So I guess it's being a little provocative, or just or it's getting attention, just because of the nature of what people are seeing with a client of ours like Pam, like swinging kettlebells around at age 72. It's like, whoa, what is that? Um, and sorry, I got some lighting issues. And it's just I think it's just challenging some of the conventional advice that's been out there, in terms of women, aging, bone health, and that the general consensus is that people need to, you know, be careful. Lifting weights is bad. It's dangerous for your bones. But when you start seeing people, lifting weights, lifting kettlebells with good form, good technique, seem like they're doing fine. I think that's what's getting people's attention. Uh, the second part of our content is we absolutely want it to be educational. We want people to know that there's real clinical science behind everything that we teach, everything that we show. This is not a this is real stuff. This is real life. These are real clinical observations, again, based on best available research, keeping things safe, keeping things effective, and we want people to just be educated about this topic. There's so much information out there, and I know that I'm contributing to creating more information, but I hope that some of our information you guys will find useful and helpful, and to, again, kind of guide you guys, but also make sure we keep things safe and make sure that nothing bad happens if people start to do some of this stuff. And lastly, we want our content to be motivational. We want people to show what is possible at any age, at any starting point. Um, we want to be realistic with certain things. Again, you guys will see a wide host of different types of people on our channel. People just coming from different starting points. They have different goals. They have different motivations at different stages in their life, and we hope that people don't think that they have to start swinging kettlebells or lifting heavy right off the bat, especially if their condition is more advanced. It's just not going to make a lot of sense for someone who's a little bit younger, has a good, what we say, a good baseline of health to be able to make some changes, to make some, um, make some, yeah, just make some real changes now. And so that they can start to set themselves up for a really good quality of life, 5, 10, 15 years from now. That's what we really want people to understand, is that know what it takes to just kind of take that first step in that right direction, and make sure that you have some level of guidance, so you're not just, trying things randomly. So that's the goal of our content, especially moving forward, just to give people just some advice or just some information of what you can do, to make sure that we obviously keep things safe, but also you guys can get your result. So who are we? Who are these people that are showing up online, balancing by the restoration? So before we really get into the weeds, I just want to introduce you guys to who we are and just kind of what we're about. So first off, this is our family. This is the most important part. This is myself, my beautiful wife, Twee. our son Maddox holding kettlebells. Madeline, she just turned 6 years old. This was her birthday. And of course, our little Maltipoo Teddy. He's part of the clinic as well. And this was us Chinese New Year. My stepdaughter Destiny as well. So just beautiful family. This is what we do everything for, is for them. So yeah, so that's us. This is the family behind Balance and Body Restoration. And this is our team. We're just a small little team here. It's just myself, again, my wife Twee, who's the co-founder of our business. She's also our massage therapist and also keeps everything together behind the scenes. None of this stuff is going to be possible without her. Just kind of the stabilizing foundation behind everything we do at the clinic. It allows us to be able to do things like this because she's the ones that's taking care of everything on the back end. So, big shout out to my wife here. She's in the back, watching from the phone, just making sure everything is good on that end. Dr. Austin, our chiropractor and head strength coach, and he's you guys have probably seen him in some of the videos as well. Just an excellent clinician. He's a professional power lifter, so he brings a professional strength training background to our clinic, and having the degree in chiropractic also allows him to be able to treat patients in pain and be able to bring a different viewpoint to our clinic. And of course, Teddy. Teddy's our little Maltipoo. He's the chief morale officer, the client relationships manager. He greets all the clients. He's a wonderful little pup, and yeah, everyone loves. I think they come for us, but I think they stay for Teddy because he's always giving hugs and getting belly rubs and everything like that. So this is us. Um, and what we actually do is we want people to understand like what we actually do. Again, we're not a general fitness gym. We are a rehabilitation clinic that uses an integrated multidisciplinary approach. Again, physical therapist, chiropractic, massage, strength training under one roof. And for years, we specialized in the hard cases, patients that have already pretty much tried everything else. We treat herniated discs, people with chronic back pain, degenerative disc disease, stenosis, hip pain, sciatica, post-surgical rehab. And again, we've got a wonderful team here, again, small, tight-knit team. And we really try to work with people where they're at. Every every treatment that we do is individualized for the person instead of just kind of this cookie cutter, just run of the mill, therapy clinic that we see a lot of people getting. So that's just a little bit of background about who we are. And yes, we are located in Dublin, California, in the East Bay, near San Francisco and Oakland, and now a rapidly growing global community of people as well. So welcome everybody into our little world. So how do we get into bone health? So obviously you guys are here for bone health, not specifically for pain or rehabilitation. And so let's just get into kind of how we started getting to this stuff. So it started with our own clients who would kind of started with us with pain or injury. Again, sciatica, herniated disc, chronic back pain. And our job was to get them out of pain back to normal so they could start just living the normal life again. So once they were done, they were kind of done. We discharged them and they kind of went off on their own way. But then as they started to see stuff on social media, worried about their bone health, they would try to exercise on their own, sometimes with a trainer, sometimes at an exercise class, sometimes at home, just doing things on their own. And they had to come back because they got hurt again and weren't sure why. So we'd have to, work the shoulder again, work the back again. And some people got to a point where they were just like, you know what? They asked us if we offered that ongoing strength training for their ongoing bone health because they felt that they could trust us with their pain or injury. So why couldn't they trust us with their ongoing like strength needs? So we said, yeah, absolutely. We'll take you on. We'll help you train. We know how your body works. We know what it can and cannot do, and we definitely know how to, exercise, functional training. We know how to safely load people. So we started doing that. So they chose to stay. And as they continue to just build strength and just started to get stronger and feel good, it all just kind of started to work out. And then after a couple of years, some of our clients started getting their bone scans back. I think a lot of you may have seen Pam, definitely one of the highlights of some of our clips. And just a couple months back, she said she had an appointment with her doctor and said that her osteoporosis had officially moved from osteoporosis back up into osteopenia. Pretty cool. This is showing her femoral neck T-score. And for those that are curious, her lumbar scores also did improve. There was just a little bit of issues with some of the readings, so that's why I didn't want to post those. But those also significantly and statistically improved with the weight training program that she did with us. And one thing I want you guys to realize is that she didn't really come for like bone density training specifically. She was just coming for just, strength wellness just because she felt good when she was doing the strength training with us. She could do everything she wanted. Her body doesn't ache, it doesn't hurt. And she's just kind of able to live life the way that she wants. And she just got a DEXA scan and she shared with us, and we thought it was like really cool thing that we wanted to kind of share that, hey, this is something that can actually work. If you strength train the right way, if you do so with good form technique, not only can you feel good, but you can also potentially like move your bone scores. We thought it was the coolest thing. And another thing about Pam is that she was not a lifelong athlete or a lifelong weightlifter. She started with us with chronic back pain and shoulder issues. She couldn't even lift her left arm above her head. She couldn't stand or bend or really pick things up when she started with us, and she was 68 at the time. And but so we really kind of started from scratch with her. Just started with her, just super light weights, 10, 15 pounds for a couple months, and just started to slowly started to add in more and more. And just the consistent effort that she put in, just week over week, month over month, year after year, she's gotten to a point where, as you guys have probably seen, she's doing some pretty incredible things in terms of the amount of weight that she's able to lift, but more so with the level of form and technique that she's able to do it. It keeps her body safe. It feels good when she trains. And that's the most important thing, that the message that we want to get across through this webinar is that if you do it, if you go slow, if you go safely, and if you just take your time with it, then pretty cool things are possible. All right. So I have this light that goes off if there's nothing that moves. So I may have to wave my hand every now and then. We'll try to fix that for the next time. All right. And for me personally, why am I at a point where I can be talking to you guys about bone health? There's a lot of people out there, experts, people that work with a lot of people with bone condition. So I just wanted to take a minute just to share my journey with you guys. So just kind of establish some of the credibility that I may or may not have in your eyes. Again, got to have nothing to hide from you guys. There's no incentive for me to say I am something any more than I actually am. So here it is. So I started with undergraduate. I got my degree in kinesiology at Penn State. And part of my undergrad, I was assistant in a lab, in an exercise physiology lab that was actually funded by NASA, where we were studying the effects, the physical effects that astronauts had in coming back from space in terms of things like bone loss, muscle deconditioning, the inability to regulate their heart rate or blood pressure. And that was a pretty interesting, study that I was assisting, because astronauts would be kind of coming back from space, and they'd be passing out in the cockpit, and they didn't know why, because the fact that they were up in space for so long, it threw off their body's ability to regulate their blood pressure. And so they were having to test various forms of, medications to make sure that, the astronauts were able to maintain and regulate blood pressure coming back from space. And then also studying, again, the effects of deconditioning on their bone health. Astronauts would come back, they would leave Earth with, obviously like thick bones in great shape, and they come back and show significant bone loss, muscle loss, sarcopenia, all these things. So that's where I was just kind of an assistant in that research lab that was studying all these things. And then at Boston University, at my doctorate of physical therapy, where I got my doctorate, um, I the second year I was there, I did a clinical rotation at a hospital called Beth Israel Deaconess Medical Hospital in Boston, and I was on the orthopedic trauma floor. So we would be seeing people who had back surgery, broken legs, broken femurs, broken hips. And it was our job as a physical therapist to evaluate, treat, and try to, safely discharge people to either home or rehab. So it was a really, I'd say, a pretty chaotic experience, because it's just something that I just never really thought I was going to do. But I'm obviously very grateful for that experience, just to see what happens to people when they do fall, break their hip, break their femur. It's very traumatic, and it's just a very eye-opening experience just to see what happens to people. And it's um we just don't wish that upon anyone, but things do happen. And we just want people to just be aware that these things happen so that you can try to prepare for them, that you know, how to take care of yourself and just, all these things moving forward because a lot of people they've never seen it until it happens to them or if they see it happen to a loved one. It's just again such a traumatic experience, but we do want people just to be knowledgeable and prepared for what it is ahead. So the research I did there was studying the effects of drugs like Fosamax, bisphosphonates, because I saw two patients in person. Just I treated them because they came in with atypical fractures of the femur because they were on this drug for so long. You know, that's the alleged, why they think it happened. So I started doing my research in that to try to figure out, what more could be done or what could do to prevent this thing or to be able to get this knowledge out to more people. And we'll be going into more in the weeds of that in a little bit later. Then after I graduated, I worked at a clinic in San Francisco. Again, one of the best clinics in the area. Got to work with some of the top surgeons, top orthopedists, back surgeons, knee and hips, surgeons in the area. So just a wonderful experience where I really started to kind of learn how the body works and started to learn what it takes to get people better. And then 2018, we started Balance and Better Registration. Started with my wife Tree, who's a massage therapist, and we just kind of combined our skills because we just wanted to be able to offer more to the public. Don't want to talk too much about this right now, but a couple things in the physical therapy profession that were getting in the way of us being able to really treat patients in the way that we really knew or wanted to. So we had to go out, do our own thing, and here we are doing this now. So and throughout the whole time, my whole research, everything just in the back of my mind, the bone health was always in the background. I was always thinking about it. I just wasn't really in a position in those years to really develop a bone strength program. Just again, I'm just a staff physical therapist or just kind of getting started off. These things are just not in the front of my mind, but now they are because again, we're starting to get some of our results back. Again, so these are things I've just wanted to share for a very, very long time. So here we are today. All right, so let's be clear about we're going to be going over today. We're going to try to move fast because there's a lot to cover. This is not a quick fix program. Just do these exercises and your osteoporosis will be reversed. That's not what this is. This is not a diet, nutrition, or hormone program. They're all very important. It's just not my area of expertise. We'll be addressing a little bit, but again, it's just not. I don't know enough about it to really present on it. And this is also not a sales pitch. I do not have a program to sell to you guys today. I don't have a program. I don't have a course. I don't have any of this. So please just lower down your guard if that's what you're anticipating. This is just only just me sharing what I know clinically and honestly, right? We want to provide people a foundation of knowledge for navigating a very complex topic, right? And one that deserves more than a quick answer. We've gotten a lot of, again, comments, questions, direct messages, emails, and we try our best to respond, but it's just so complex, and there's so many more things that people need to realize. So that's why we're doing this now. And this is also just the beginning. There's going to be a lot more to share. Hopefully, we can get just more information out there, be covering more topics and things that you guys want answers to. We'll try our best to deliver. So again, just getting started. And stay to the end for the gift. All right. So we do have a gift for everybody if you stay till the end. I think it's gonna be pretty cool. Just as a personal gift for everyone, just kind of joining our community. It's been really cool to see so many people come on board. So we want to actually give you guys something, but it won't be ready until July. But if you're here today, you will get a chance to claim a free gift. So it's something I'm actually really excited to share with you all. So stick around till the end. All right, stick around. So we'll be giving away some freebies. All right, so what are we covering today? So a lot of topics. We're going to try to get through things as fast as we can, but also make sure that we give the things the detail that it needs. So we're going over bone physiology, Wolff's Law, what bone actually is. We're going to touch on pharmacology. Again, I will say that I am not a doctor. I cannot prescribe medications or anything like that. I can only give you my perspective as a clinician who has to advise patients who are thinking about taking these drugs and just to share again knowledge of what I know, knowledge of what's out there. So that's what we're just going to talk about, just the realities of what's out there. We're going to go into the research as well. This is not just me showing some exercises and hope for the best. Everything that we do is going to be clinically backed with the best research. So we want to make sure that we get people up to speed on what's out there in the research, and then how we can apply those lessons to help you all. We're going to be going over the three groups of osteoporosis patients because, again, advice that is going to be right for one is not going to be right for another. So just getting very clear on who you are and what you need to do moving forward is something that we also want to discuss because, again, there's going to be such varying degrees of different advice and information that's out there that might be appropriate for some, but it's just not going to be right for others. We're then going to get into the principles of safe and effective strength training to make sure that if we're going to do this, we're going to do it the right way. We're going to try to our best to minimize risk of pain and injury and try to give you guys a shot at actually doing this. So we're going to be talking about everything we know on how to do it right. And then we're going to talk about the path forward and what it's going to take for you guys to get there and what the next steps need to be. So that's what we'll be covering. All right, first section, bone physiology. All right. So we're going to go over what bone actually is. Again, this could be a pretty long topic. We're going to try to go through it as much as possible, but just to get everybody up to speed on what they need to know about the physiology and anatomy of bone. So first off, bone loss is not just the number on a scan. 1 in 2 women over the age of 50 will have an osteoporotic fracture in their lifetime, based on current research. It's greater than breast cancer, heart attack, and stroke combined. 20 to 30% of people who have hip fracture will never return to their prior level of independence. So avoiding these fractures at all costs is something that we just have to keep on the top of mind when we are talking about stuff like this. And they're also silent, especially the vertebral fractures. So many people I've talked to have said they've gone in for a DEXA scan or an X-ray, and the X-ray or CT scan or whatever shows they have vertebral fractures. They had no idea, completely silent, right? It's just a little gradual posture change. They're a little stoop forward. They lose their height. They have back pain. They just told us part of aging. So again, just a huge just kind of things just kind of knock people out of left field when they're just diagnosed with fractures in the spine, have no idea why. It's just crazy. And again, you have to be so careful of this cascade. If there is, God forbid, a fall or a fracture, which leads to bed rest, which leads to immobility, muscle loss, it predisposes people for another fall, and just again, this cycle that I saw personally in the ortho trauma unit. Not trying to fearmonger. This is just the hard, true reality of what goes on, and we want people just to acknowledge what it is so we can start to plan for it instead of just wishing it away or just pretend it's never going to happen. So the more we can be aware of these things, the more we can start to prepare for them. And strong bones is not just about preventing fractures, guys. There's so much more to bone health, bone physiology that we are learning now that just impacts so many other aspects of our life. Your muscle health. You can't build bone. You can't build bone without building muscle. And stronger muscles are going to be better balance, faster reaction time, better independence, better ability to physically do things. Your brain health. Bone's going to secrete certain chemicals, uh, especially during loading, which can have direct effects on memory and learning. Right, we're going to be going more into those topics a little bit later on, but there's so many different connections between bone health and different parts of our physiology as well. Metabolic health, because resistance training for bone health is going to improve everything. It'll improve your insulin sensitivity, reduce your fat, weight loss, improve cardiovascular. So even if you're doing a program for bone health, if you do it right, you're going to get health for everything as well. Your posture is going to get better. You'll be able to stand taller for longer. You'll be able to enjoy your life longer, not just living, but also just thriving during those years. If you are able to develop stronger bones, most importantly, just your independence, be able to do things on as you want to, be able to live life without restriction, carry groceries, go up and down the stairs. Not saying that you got to do crazy things, just to be able to do the things you want to do. And that's really what this is all about, is to focus on your bone health, and everything else will also be able to fall in place. Could spend an entire semester on this. I'm not going to do that today. We're just going to try to, again, move as quickly as possible to get you guys the information that you need. So first off, bone is not static tissue. This is the one big misconception that I think people have. It's a big wake-up call when they realize that bone is not like this concrete that you have that's fixed and permanent, that just slowly crumbles with age and that there's nothing you can do. That is not how bone works at all. Bone is living tissue. It has its own blood supply, it has its own nerve supply, and it has its own cellular activity that's constantly happening. It may happen at a slower pace than a lot of our other tissues, but is no different than from our muscle, our skin, our blood, anything else. It's as living tissue as anything, any other structure within our body, and it's constantly remodeling. They say that every 10 years, all of the bone cells that you have now, 10 years from now, will be completely gone. They would have turned itself over during that time period. So again, bone is this constant dynamic living tissue that responds to signals. And it's the signals that you give your bone through load, nutrition, and hormones is going to determine how it actually adapts. So here's a diagram of what it looks like. So again, don't want to get you guys too confused. Just want to give you an idea of the players of bone physiology, just so you have an idea, because it's going to set the framework for literally everything that we're going to do moving forward. So first off, we have the cell in the middle called the osteocyte. It lives in your bony tissue within your lacuna. And there are these little spikes and these little sensors along this osteocyte, which is going to be able to detect signal. And once based on the signals that it detects, it's going to kick in some of these other players, this big red blob called an osteoclast. This is the cell that's responsible for kind of eating up in old dead bone tissue, because we want again, bone is constantly turning over. So there's this constant cycle of cells that eat up bone and these osteoblasts, which then lay down new bone. So this osteoclast is going to eat up some dead bone or old bone. It's going to leave a resorption pit. And then the osteoblast will then cover that pit with new bony tissue. And then it's going to start to form some of these bony matrices as you see down here. All right. So again, main players, osteocyte, osteoclast, osteoblast. Very, very important moving forward that we just understand what we're trying to do if we're going to be doing this type of training. So Wolff's Law. So this is the number one physiological principle that people must know about if you're going to be doing any type of strength training for bone or be going on any program. So Wolff's Law is based off of a German anatomist who observes that bone tissue reorganizes its internal architecture in response to mechanical forces. So basically, if you stress your bone, it's going to get stronger, denser, and more organized along the lines of force. If we remove the stress, it's going to weaken, it's going to thin, it's going to lose density. It's not theory, it's just proven physiology. This is how it works. And this is Wolff's Law. I don't think the sound is going to work, but I just want the video to hopefully prove the point. This is not AI. It's real. Would not want to mess with her, right? She's a Muay Thai kickboxer from Thailand, kicking down a banana tree with her shin. Right? Something about Muay Thai or kids in Thailand, if they want to be fighters growing up, they'll start kicking trees at the age of 4 to harden their bones because they'll have to be kicking against other people's in their legs and their shins. Crazy sport, I know. But this is what happens to someone who starts at a very young age, develops bone stronger, stronger, stronger to the point where they can actually kick over a tree in their adult age. So that is Wolff's Law applied. There's no other way for me to show what's possible to increase the level of bone strength in something like this, right? And if you can't hear it, like when she kicks the tree, it sounds like gunshots. It's crazy. All right. So there's another diagram. So back to the astronauts in space that we talked about. Without load and gravitational weight bearing, we saw astronauts losing bone tissue at a pretty alarming rate, just being up in space for a couple months. Crazy. Right. And then obviously the Muay Thai kickboxers, the more you stress those bones, the more it's going to trigger growth. So you get this kind of weaker bone tissue here because of lack of stress. And then you get more thicker, dense bone because of more stress that you put on. Right. So that's Wolff's Law. And that is the physiological principle that we need to understand if we're going to be doing something like this moving forward. So how does this apply to you specifically? Patients with osteoporosis, right? So we know bone is living tissue that responds to load, and we know that it's going to weaken if you remove those stress. So why does it, dramatically affect women after 55 more so than men, right? Because men are equally as sedentary as women. Then why aren't as many men, having to deal with this issue? Has to do with hormones, right? Specifically estrogen, right? So before menopause, the resorption, osteoclast function, and formation, osteoblast is going to be balanced. So you're going to get this balanced turnover where you have maintained healthy bone over time. But something happens when estrogen declines. It's going to start to tip the scales of the resorption into more resorption and less formation. So you get a thinning and a hollowing of the bone, right? And as it happens for many, many years, you're going to even less bones because you're going to get so much more resorption compared to the amount of formation. And that's essentially going to be what osteoporosis is, which is a lessening and a weakening of your bone tissue. There's just not enough bone. And you can obviously see how this bone is going to be a lot more frail and a lot more prone to fracture than having thick, dense bony tissue. All right. And there's other factors beside estrogen, of course, vitamin D, low muscle mass, sedentary lifestyle. And one thing that I actually heard from an endocrinologist client of ours is that she's seeing a lot more men in her clinic now than she ever did before, um, which is something that is was pretty surprising to me when I heard that. But it's actually not surprising to me because of people that are on more, vegan diets. They've been sedentary for 15, 20 plus years now. We're seeing a lot of those types of clients, actually show that there's bone loss even in men now. So things are starting to tip in that direction as well. So again, this is going to be primarily for women, but I think that men need to also be alerted to this type of condition as well. But the problem is, the common advice that people get when they're diagnosed with osteoporosis is to walk more, get your steps in, stay active, take calcium, vitamin D, and consider the medications, right? All very reasonable, but none of them really look at the complete picture. So is walking really enough? I'd say walking is generally good for pretty much everyone. Cardiovascular health, mood, mental well-being, balance, coordination, so many benefits to walking. But if we're talking about bone density specifically, it's just not enough mechanical strain for most people to build bone. It does not cross what we call the minimum effective strain threshold to actually stimulate bone growth, to get that osteocyte to actually trigger growth. And the result is there's going to be no new bone formation despite taking the advice that you were told. Just walk because it's good for you, but don't think that it's going to be enough to actually protect your bones. All right. That's one of the messages that we want to get across. And calcium and vitamin D are essential. They are the building blocks that you need for bone, right? Without adequate calcium, there's no matrix to materialize. Without vitamin D, calcium cannot absorb or cannot be absorbed properly within the bone tissue. But the problem is these are just like building blocks. And if you don't have a mechanical load to actually, trigger that growth, it's going to be like you have all this building materials in front of a house, but no one's building because no one's telling the workers to get to work, and the materials are just sitting there. So that's what calcium and vitamin D does. Without that stimulus, it's just going to sit there and just not really do anything because it's not being asked to. So you can't only just supplement your way to stronger bones. You need that mechanical load. That's what we wanted to get across. So what do we do, right? What's the solution? If we know that bone is living tissue that responds to load, and we know what happens when that load disappears, we know calcium and vitamin D and gentle exercise are not enough, what are most people told to do next? So let's talk about that. Pharmacology, all right? So again, huge, huge, huge disclaimer, guys. This is very, very important. I do not want anything that I say next to be taken out of context. So very important. I am a physical therapist. I am not a physician. I cannot prescribe medication. I will not tell you what you should or should not take. And I want to be clear that I would never try to. I can't. What I'm going to do is share with you how I think about these medications in my clinical practice. Because when I'm working with a patient who is on a drug like Fosamax or coming off something like Prolia or wanting to go without it, I have to understand the physiology because I'm going to be working with the patient, going to be exercising them. So I'm going to be giving you my standpoint for how I view these drugs, working clinically with patients, right? But in that clinical decision making is my responsibility as their provider. So what follows is just my personal understanding of the pharmacology based on publicly available research, my doctorate research background, which I studied this for well over a year, and my direct clinical experience working with this population. So please bring any questions about your specific medications to your physician, your endocrinologist, your primary care. They know your full medical history. I do not. This is not medical advice. This is just my clinical perspective. So if we can all be clear on that. So here is my clinical background research. So I did do a little paper, right? Management of bisphosphonate related subtrochanteric fractures of the femur. I did a systematic review, a case series, and I also developed a screening tool for physical therapists. All right. This is what I studied. All right. And this was based off of, again, a couple of cases that I saw in person. And then I started to do some case study research and some of the files of patients that had come in just a little bit before I actually came in. And this is one of the patients that I saw. This was, again, her fracture here that she had. Clean break, medial break, 69 years old, right leg. It gave out, literally just going down a step. X-rays showed that again she had a medial break. And one of the really, I'd say, like kind of eye-opening, almost kind of frightening things to me was that this lady was diagnosed. She had leg pain before her leg gave out, and it was diagnosed as sciatica from her physician. That leg pain that she had was a stress fracture that had been building for months, and no one had any idea that it was happening. Right? Just wild to me. Um, Case two, 59-year-old female had again, another right leg fractured. She had to be fixated with the rod here. All right. Upon X-ray, there was actually evidence of a stress fracture developing on her other leg while she was going under surgery for this leg. So they had to prophylactically fix the other leg just to make sure it didn't give out on her, right? And that's what she had to do. She had to have one leg done. Then they saw a stress fracture in the leg. They had to do the other leg, right? So again, this is what I saw in person. Just some of the most like eye-opening stuff. I had no idea that this stuff was even happening, no idea it even existed at the time. So that was like, okay, I'll do my practicum on this topic because this is something that I find really interesting. I saw it in person. I just felt compelled that I needed to do more work to research it. And let's talk about the different drugs, right? I'm not going to go too deep because I don't really know the physiology of all these drugs. I do have, again, good familiar with the bisphosphonate groups, your Fosamax, Boniva, these types of drugs. I'll be showing what I know. There's more anabolics, which are going to more stimulate bone formation, where these bisphosphonates, slow down the resorption. And there's some dual effect ones. Again, I need to get up to date on these, so give me a little more time. But these are some of the drugs that are out there right now. We could spend 3 hours alone on the pharmacology alone. So please spare my if I'm not as thorough. I'm just gonna again share with you guys what I know, and we're gonna be talking about specifically alendronate, which is also sold as Fosamax. Fosamax. I don't know the pronunciation, but it is the most commonly prescribed bisphosphonate, and it's what I think a lot of you have either taken, have been offered, and have heard about. And again, it was at the center of what I researched for a full year at university. So we're going to try to understand how alendronate works and what happens over time. And that's what we're going to focus on next. All right. So how bisphosphonates work, right? So again, let's go back to our players in terms of bone physiology. Uh, Again, osteoporosis is going to happen when you have more resorption, more osteoclast function than formation, osteoblasts. So when there's more resorption than formation, you're going to get net bone loss. So that's what's going to happen with osteoporosis. What the bisphosphonates do, the Fosmax, is they're going to come in and bind themselves to the bone tissue via these little structures here. And as the osteoclasts, the red guys, the eaters, encounter them, they go away. So you don't have this resorption anymore. You don't have the eaters that are eating up the bone. So you have these osteoblasts, they're just laying down bone on top of bone on top of bone. And look at this, guys. You get a lot more bone tissue as a result of being on these drugs. How amazing is that? You take a DEXA scan, you have all of a sudden have more bone, and it's there. It's just bony tissue that's now there that wasn't there before. So that's what these drugs do, right? And the research backs it, right? This is real stuff. These things have a very net positive effect for a lot of people, right? Um, the FIT trial was the one by Black. This is back in 96 and 2000. This is the one I studied a lot of when I started to learn about this drug. And just some of the big picture numbers that they saw was a 51% decrease in hip fractures. And it was the first time a drug was shown to prevent hip fractures, especially in women. Um, there were 48% fewer vertebral fractures than there were before, all confirmed through X-ray. And across the board, just 30% fewer fractures overall. And this was a big study, guys, almost over 3,600 people. So, um, and another thing about these drugs is that the research has held up over the years. Systematic reviews have showed that all four bisphosphonates do effectively prevent fractures versus placebo for most people. This study here, they replicated the FIT trial through the Horizon trial and found the same thing: significant reduction in vertebral, hip, and other fractures. And then 2023, they did another study where it was essentially recommended for a lot of people as a first line treatment for postmenopausal osteoporosis patients, and is at the highest level of clinical endorsement. Right, so um, the research says it works, right? But we have to be clear about how it works and what also happens to these things long term. All right. Because a lot for a lot of people, again, it's going to be the right decision based on what the research says, right? But there's a huge but that we have to talk about, and that's what we're going to talk about next. So if we just look at just the basic physiology of bone tissue, right? There's a reason why osteoclasts exist. As we said, bone is constantly evolving, it's constantly turning itself over. And if it didn't exist in Mother Nature, then it shouldn't exist because if you have unchecked bone growth, then you have unchecked bone growth. And that's going to lead to some side effects if you're on it for too long because when you mess with Mother Nature, it's going to come back at some capacity in ways that you may not realize until a long period of time. So in the beginning, you may have thicker, denser bones, especially in the short term, right? But the problem is there's nothing really eating up this more older bone tissue that's not as strong and not as viable. So over time, you get more layering of new bone on top of old bone that could potentially be splintering and cracking underneath the seams in ways that you just may not be able to feel that's going on inside your body. Over time, it's going to lead to potential stress fractures, which is going to lead to potential, again, insufficiency fractures, torsional fractures where the leg potentially give out and snap in half. Also, a huge one, osteonecrosis of the jaw, the TMJ joint. People have to have like their bones removed from their femur to have it surgically implanted into their jaw. It's like crazy stuff. Some of these long-term side effects. Again, not saying this to scare people. I'm just saying this is just the reality. I saw it in person. This is what the research says. I'm not making any of this stuff up. This is the mechanism, right? And they state this is the mechanism based on just long-term studies. All right. So here's another study that shows what's going to happen to people long term. So in the short term, the risk of these AFF is atypical femur fractures. It's going to be pretty low, right? Compared to the risk. This is the risk of having an atypical femur fracture the first 0 to 3 years. But once they started to analyze people that were on the drug for 3 to 5 years, the relative risk of atypical femur fracture started to climb to about 8.8 times X. People that were on it for 5 to 8 years, 19 times. And people who were on these drugs for 8+ years had a 43.51 greater risk of potential fracture, especially Asian women. Something about Asian women where they had a 4.84 times higher risk of atypical femur fractures compared to Caucasian women. Very, very important that I don't think anyone's really been talking about out there. So that's why the discussion about how long you're on this matters. They have all these things like drug holidays and things like that. We're going to try to go into that, but this is not me making this up. This is 196,000 women that were studied 50 plus over a 10-year period. Right. This is done by Lowe, sponsored by Kaiser. Right. So a lot of the research that people will see in the short term after 3 years, all right, where For every two atypical femur fractures that happen, you will prevent 149 fractures within the first 3 years. All right. So, by all measurements, in the short term, it's pretty clear and obvious if you're at a state where you have osteoporosis and want to avoid fractures in the short term, there's no doubting that this is a good option, in my opinion. At 10 years, though, if you're on it for too long, man, these fractures really start to increase in terms of just the amount and the volume of them over a longer period of time. That gap narrows significantly, right? And this is why they propose, limiting the amount of length that people are on now. They don't have people on it for more than, 3 or 5 years, case specific. All right. So this is just what the evidence shows, and it matches the physiological mechanisms that we just talked about, right? If you're on these things for too long, you get the suppression of the things that are going to eat up the older non-viable bone tissue, and that bone gets brittle. And this is how these things happen. But again, medical decisions are medical decisions, right? And that conversation is going to be up to you and your doctor, all right? And we're just going to give you our again, just our rationale for how we would advise our clients, but ultimately it's going to be up to you and your doctor. Okay. There are some very these are things you guys got to know about especially if you are on these drugs or coming off of them or thinking about taking them. These are real clinical flags that you have to be knowing about, especially if you're going to be exercising. If you have any thigh pain, groin pain, a dull ache in the thigh that persists without clear cause, you have to get an X-ray. This was our screening tool. Any woman or any person that walked into our clinic with thigh pain that were above a certain age, and if we saw on their intake sheet that they're on a bisphosphonate, we have to send them to an X-ray because we do not want to be exercising that person without knowing full well the health of their current bone, right? If you have a stress fracture, that thing might need to be prefixed before you think about doing any form of strength training exercise. So please watch out for that if you have thigh pain, have been on these drugs for a while. Jaw pain or delayed healing after dental work, right? Again, I haven't dug much into the research about it, but it's very, very clear and obvious that this is a thing that does happen, right? Have to get it looked at, have to get it checked. And then obviously just new, unexplained, or just changing bone or joint pain. People have had severe musculoskeletal pain, something that you have to talk to your doctor about in terms of staying on or getting off. Again, conversation for you and your doctor, but you can bring this to them for sure. So based on everything that we've just said, looking at the research, here's where I kind of stand. Bisphosphonates seem like they're very beneficial, especially in the short term, for those at the highest risk of fracture. That one's very clear, and I am not, anti these drugs, right? They have a place, they have a real place. They've saved a lot of lives. So I'm gonna be clear on where I stand about that. But what I am is just kind of clinically, curious, and just there's a lot of questions that I think need to be asked, and we still need a lot of answers for what to do for someone depending on your situation. So let's talk about different scenarios. 74 years old, if you have severe osteoporosis, if you're frail, more sedentary, high fall risk, I could see a case where the drugs are going to make a lot of sense for this type of person, right? It just makes sense, right? Is this person going to be in a situation where they can start to load up heavy lifts and start building bone naturally? I don't know. And would I want more bone than less bone? Absolutely. Right. Right. So again, this is just commonsensical thinking, right? Not my suggestions, guys. It just makes sense for this type of clientele. What if you're like 62, right? You have like borderline osteoporosis, like negative like 2.7, right? Or maybe you've been on it for a couple of years. This is my biggest question, right? So again, maybe 62 to 65, you want to strength train, but what if you've been on it? This is my biggest question. If you've been on it for 3 or 5 years, now what? Right? That how I don't know how safe it is to load that bone with heavy resistance training. someone's been on this drug for like 3 or 5 years, where some people have been susceptible to their bones breaking, stepping off of a curb, I don't feel good about doing squats or deadlifts or kettlebell swings with that person. I don't feel great about it, right? It makes sense. I don't have a definitive answer for how to go about loading it. I think the research is still needs to be done. There's some saying that it's safe, but just my gut feel is like I want to really know more before I start to load up this person with strength exercises, right? We definitely need to get an X-ray if they have thigh pain. It's clear as day. They need to get it checked. But that's something that we just need more time on. All right. And then we have a 65-year-old, maybe been more sedentary, got some orthopedic issues, haven't really considered strength training. And now you have osteoporosis. You have this decision to make. Do I go on these drugs? Do I do weight training? Is weight training good for me? Is other drugs good for me? And it just depends. There's so many variables, right? Severity of your osteoporosis, the ability for you to commit to a program. If you've been sedentary for a while, there's aches and pains. There's no guarantee that you're actually going to be able to load your body to a point where you can stimulate bone growth. But again, if you're young, if you're 62, if you have a chance and you start to go on these drugs, like, what happens after that if you're on it for 3 to 5 years? Like, these are just questions that are still on my mind and things that we still want answers to. So, so yeah, just to go more into that point is, can you strength train? Again, the research says exercise and bisphosphonates work through separate mechanisms. Um, we're going to talk more about the research and things like that. Um, Again, some models suggest that uh, it may be safe, it may not be safe. It's just not quite clear to me. Um, my instinct says that if you have strong bones on a DEXA scan, that doesn't always mean that those bones are going to be tough enough to resist torsional forces against, especially with like squatting and things like that. If you load this hypermineralized bone with accumulated micro damage with high intensity, like doing box jumps or things you see, guys, I don't feel good about that. Um, we have to assess people before they load. That is a non-negotiable. It's not optional. Thigh pain, fracture history. These are all just very, very important clinical decisions. These are things that you guys have taught have raised to me, and the question is, I don't know, but we'll try to figure it out together. All right, we'll try to figure it out together. All right. All right. So now that we've gotten some of the heavier stuff out of the way, let's uh, let's talk about some alternatives. So this is where things are going to get good. All right, let's talk about alternatives to drugs. All right, so before we get into the exercise, we got to talk about the research about natural bone growth and what the science actually says and what it leaves out. All right, so we just spent a lot of time on what can go wrong. All right, it's pretty heavy stuff: falls, fractures, drugs, atypical femur fractures. It's just a lot of heavy stuff, guys. I don't want this whole webinar just to be all this, negative and fear. Let's start talking about some stuff that we can actually do to reverse this. Yeah, how's that sound? Right? So the reason why I bring up Wolff's Law in the beginning is because we have the mechanisms within our body right now to be able to build and maintain, even rebuild bone. We don't have to fight against biology. We just have to work with the principles behind it. So we said, what can we do? Mechanical loading through Wolff's Law. This is what we've been building up towards all workshop. How can we actually safely load bone so we can actually build bone? Bone responds to mechanical stress by getting stronger. The osteocyte senses that load, triggers the remodeling process. That's how it works. Right. And this is the mechanism that we are deliberately harnessing through progressive resistance strength training. HRT, hormone replacement therapy. Right. We talked about decline in estrogen being what appears to be the driving force behind why women, more so than men, despite sedentary lifestyles and things like that, um, potential obviously for estrogen hormone replacement therapy to be one of those things that can really help boost it. This is not my area of clinical expertise, but it's part of the process. So we do need to have some understanding of it and to give it its weight. I can't be talking more about this in today. I'll try to, talk more about it in the future once I know more about it. But it just makes sense if we just look at the whole kind of process where hormone replacement kind of fits in to the whole picture. Okay. So I wanted to address that. So let's talk about the evidence for loading bone and how it can actually do it. All right, so we had a pretty cool longitudinal study. These are some of my favorite studies, like the Framingham Heart Study, which studied the risk factors for heart disease. It tracked people for, decades to see what caused, cardiovascular risk, smoking, sedentary lifestyles, things, obesity, things of that nature. So the Erlangen Fitness and Osteoporosis Prevention Study was run from 1998 to 2014. That's a long, long, long time that they were able to accumulate data, and it's the longest, trial for bone health that was ever conducted. And it essentially showed that progressive resistance training and impact exercise halted and in some cases reversed bone loss. Right. We'll probably do a deep dive into this study at some point. I just want to address these things now. Don't want to get too far in the weeds, but we'll be definitely going over it at some point in the future. O'Brien, this was a systematic review. Systematic reviews are one of the highest levels of evidence, which is essentially congregating all the best available research just to see what are the effects of progressive resistance training. And what it came to the conclusion was 3 times a week, 70 to 80% of one rep max intensity with weight bearing and impact loading exercises seems to increase strength and bone mineral density in older adults. Zhao 2025 meta-analysis also showed the same thing. It just congregated all the studies about bone and resistance training, congregated all the data and said that it did have an impact on hip bone density in postmenopausal women. So top tier research says that not only can you do it, it's being done right now. So this is not theoretical, it's being done right now. And then there's the study that gets all of the attention because it's what a study this thing was. The Lift More study. I think a lot of you are familiar with it. If you're not, we're going to be going into the weeds we're going to be going into more depth about it. This thing was very, very well designed, rigorously supervised, and produced results that were genuinely groundbreaking. I think that is what really the study has really what has kind of spurred on this movement just in the past couple of years. This was in 2018. So let's dig into Lift More, right? So Lift More, the lifting intervention for training muscle and osteoporosis rehabilitation. Study design, post who it was for, postmenopausal women over 58 with low bone mass. Duration, they trained for 8 months, twice a week for 30 minutes a session. Not bad, not bad, right? It was fully supervised, maximum of 8 participants per instructor. The two groups of women, which is a high intensity resistance interval training group, 49 people, versus a low intensity home program. So these weren't people that were just sedentary, they just had them on a lower intensity home program. So they're trying to see do they really need to lift weights or is just kind of walking, kind of like basic exercise good enough? Published in the Journal of Bone and Mineral Research 2018. Why has this study earned so much attention? Again, conventional wisdom. We talked about walk, vitamin D, take it easy, don't do anything risky. Bone people are frail, don't load it. It's going to cause fractures more. This study just completely shattered that narrative, right? And it's actually found that high intense resistance training can actually be beneficial for bone, not harmful. How crazy is that? Right? What do they actually do in this study? It's pretty nuts. Deadlifts. Well, first, let's talk about the intensity, right? 5 sets, 5 repetitions, this greater, about 85% of one rep max, twice weekly, fully supervised. The exercise they did, the deadlift, primary hip hinge, you guys have seen us demonstrate that on our social channels, I'm sure. Overhead press, one of my favorites as well. Upper body pushing, loads the spine actually down, right? Also builds upper body. Back squat, right? Primary knee, hip, femur stimulator. A jumping chin up with a drop landing. Whew, that's intense, right? Jumping up and chin up and just landing down. So the first thing I thought when I started to dig into the exercise itself was like, this is a pretty intense program. Like it's very brave, very I'd say ballsy to get people to do these types of exercises in the state that they're in. So it was very brave and a very uh um what's the word? Just yeah, it's just a very brave study to conduct. uh, considering the population. Here were the numbers, guys. Right? Um, let's look at the lumbar spine bone mineral density gain relative to loss. So the people that were in the control, the low intensity home program over 8 months lost 1.2% of bone density in their lumbar spine compared to 2.9% net gain on average for people in their spine. So this is a net change of 0.41 percentage points, 8 months, high intensity compared to low intensity. Crazy, statistically significant. Femoral neck bone mineral density, not as much gain, but look at the loss, guys. Look at the bone loss for these women. 8 months. That was eye-opening to me is how much bone got lost by just doing low intensity exercise. People were losing ground. Maybe not as much gain in the femoral neck, but they definitely didn't lose and they gained some. Interesting, right? Femoral neck cortical thickness, right? So this is going to be around the cortices of the bone around the outside edge. Look at the loss with an 8 month period. Mind blowing to me that this much bone can be lost even if you're doing if you're still doing low intensity bone program compared to this huge net gain. Wild. The amount the data this study produces is just mind blowing in both directions, just in terms of the rate at which bone gets lost and the rate at which bone can be gained with high intense lifting and stuff and things like that. Crazy. So groundbreaking study, narrative changing, amazing. This study moved the needle for sure. It's why I think a lot of you guys are on here today. It's why you see all these influencers online talking about women after 50, 60 have to do deadlifts and squats and box jumps because of what they saw in this study. And it gave the world the data to say with confidence that high intense loading is not only possible for women with osteoporosis, beneficial. Gives the scientific permission to do what good clinicians has always suspected, that controlled progressive loading is protective. It's not dangerous. It protects you. It gives you stronger bones. But with everything, guys, there's a huge but. And there is something very, very important that we need to talk about, especially for the vast majority of you guys who actually got to participate in this study. 568 women signed up, and 162 dropped out immediately when they heard what they're about to do. They're like, I got to do what? No, I'm good. So they just, I don't, they didn't want to do that. They didn't want to be doing deadlifts and back squats and doing chin up drop downs. They didn't want to do that. So 406 remained. Of the 406, only 101 made it through the screening criteria, which meant 305 were excluded for musculoskeletal issues, cardiovascular conditions. They were on bisphosphonate or medications. They had a previous history of fracture or cognitive impairment. 80%, 82% of women who wanted to participate were excluded. They were not able to participate in this high resistance training study. 82%, that's going to be the vast majority of you guys. So we have to figure out why and what we can do about this fact. Because as great as it all sounds, it's only going to be appropriate for a small percentage of you guys. And I think that's where a lot of the confusion in terms of what you guys can do, what you guys should do, is based upon this, is how do we know who's cleared? If you're not cleared, then how can we get you to a point where you are cleared? These are the discussions that I don't see happening right now, which is where we're going to have them. Right? So again, got left out. These are not rare edge cases. This is the majority of the population. I know this because I work with this population every single day. Right? This is what I know. Majority of people, I wouldn't want them walking to the gym doing back squats and deadlifts and doing, pull-up heel drops. There's no way. There's just no way. Some yes, some yes, absolutely. And we encourage that. Really cool. All right. But we want to be looking out for the people that can't do it, that were even they were excluded from the study. Very, very important. So studies like Lift More prove the what. The research says this is what you need to do. What it proved, high intense loading is safe. Another cool thing about that study is no, like I think only one person got hurt and it was like a minor soft tissue injury. There was no injuries in the cohort of the 48 women that made it through, right? No one got hurt. There was no injuries. Crazy. Produced significant bone mineral density improvements. Fear of fracture was overstated for them. In brief, 30-minute, twice a week, over 8 months was enough to drive significant change. Crazy. What it couldn't answer? What about the other 82%? What do we do? How do we regress maybe some of these movements? So a person with a bad back, bad hip, chronic joint pain, tendon pain, old injury. That's what we see all day long. How do you find that right starting point for that individual? How do you progress safely when, yeah, again, you have old injuries that change everything? All right. So let's talk about the various groups, right? We'll take a quick little question. If you guys type into the chat, how's this going so far? All right, I'm gonna take a quick little minute. We can go on at it for a little over an hour. We got a little more to go. Yeah, absolutely. What do you guys think so far? Am I boring you guys yet? All right. Have we learned something new? Are we reinforcing things that we already know, or things what have you guys found interesting so far? I gotta take a quick little break. I just want to hear from you guys a little bit first. Very useful, motivating to hear the science. We gotta go research based, guys. We gotta go evidence based. We can't be messing with this stuff. This is serious stuff, guys. Loading osteoporotic bone. Oof. Great reinforcement. Excellent point about yeah, 80 the 80 rule, guys. 80 to 80-20. 80-20. If you guys don't know the 80-20 rule, I before I read the study, I knew that the exclusion criteria was going to be about 80-20 percentage. That's what I see every day, guys. People that want to do it, they 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 can't. They have an injury. They have poor shoulder mobility. They got a hip replaced. They have a knee issue. They got issues. They can't do these things, and our job is to get to the point where they can start doing these things. Right? Wondering how to approach exercise with osteoporosis at 59. We got to start at some point. Having trouble finding PTs with background in osteoporosis. Yep. Yep. Big issue. Physical therapists are either good at getting people better or getting them strong, but it's hard to them to understand how to do both. So if you have one of these more weightlifting, strength training type of physical therapists, they may not know how to get you to a point where you can safely train. Person maybe have really good manual skills, but they don't know how to load. That's the issue, right? Do you work with a trainer or PT? Our our head strength coach is a chiropractor and 8 years professional power lifter, certified strength and conditioning coach. So he's got the certifications, and we're trying to find more people that are just really good and intuitive and know how the body works and know what's safe. All right. So you would have been excluded, Barbara. These women, where do you start? It sounds like already lost battle. No, 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 no. The battle is never, never lost. We just have to be realistic with where you're at. Um, have you heard of ostrich? I've heard of it. From I Before I say anything, I will do deep dive. But here it's more machine based than functional training based. Not my. It doesn't. It's not my thing. Not how I would do it. Very unsettling about the fragile bone underneath. Yes, yes. Short term. You like there's an explosion of new bone. That is undeniable. But I just keep thinking about so many people keep asking us questions. I'm 62. I'm in relatively good shape. The doctor just wants to put me on the drug. I don't want to do it. Their osteoporosis is like borderline, and they're just not really given an alternative to it. So that 62-year-old starts taking the drug. They could have done something about it at 62. They take the drug. They're on it for again. You can't take it for more than like 3 to 5 years. They're saying that drug holiday. You can't take it for that long because of the long-term effects. So you start at 62, you're off of it at 66, and then now what? What do you do then? What do you do from 66 to like 85? Do you go out on it again? Do you strength train with like weakened bones? Like I don't know the answer to that, guys. I really don't. And that's why it's like uh hopefully we can start having the osteoporosis. Yeah, again, severe osteoporosis. Like I it's you have to weigh so many things. We have to weigh so many factors. That's why someone with severe osteoporosis, I do not want you to be like doing box jumps off of a 16-inch box with a trap bar like I've seen online. That's crazy to me. Some people, yeah, like that elite, like 1 to 3%, sure. Not for the vast majority of people. HRT, again, not my expertise, but as we saw, it fits within the mechanism where estrogen seems to be the thing that drives the most amount of bone loss. So makes sense. I don't know the long-term side effects of being on HRT as well. Like I don't know. It makes sense, but like what are the risks of that? What are the studies there? All right. So that's where we're at. So let's get back into the presentation, guys. Thanks again for all the questions. Thanks for the comments. Again, hopefully you guys have found it helpful and useful thus far. We still got a lot more to cover. We're going to be yeah, no long-term risk. Yeah, I got to do more into the research for you guys. It appears to be safe. It appears to be effective at certain dosages. So again, it just kind of makes sense and it fits in combination with everything else we're talking about. So let's get back into the presentation. All right. So we talked about the groups, right? As we said, this comes from the conversation we're having with you guys right now. Most people kind of fit within that spectrum of 20% are going to be in 20% of people are ready, statistically ready to start to do high intense resistance weightlifting, right? Clear for loading. You guys are the lift more eligible population, right? Your path is going to be high intense progressive loading, right? Results can be remarkable. 60% of you guys are in the middle, right? You guys got something going on. I know this is what I see through our doors. The percentages absolutely fit. There's something going on, knee, hip, you've been sedentary for a while, got posture, shoulder issues. You were screened out of this study. So for all you people seeing, oh, lift more, I've got to do this stuff. A lot of you aren't ready. Not yet. We're going to be talking about what it takes to get you ready, but we want to be clear about where you stand. It's so important before you start to jump into doing these exercises, guys. It's so important to know where you stand. There's nothing more important. We're talking about like high intense like back squats, deadlifts. We love doing them. You guys have seen them. We're a fan of them, but only for the right person. Then we have the other 20%, the medically complex, severe osteoporosis, um, history of fracture. We've spoken to a lot of people that have been on cancer treatments for years, destroyed their hormone balance. Spoke to a woman 55 years old, um, diagnosed with cancer at 45, has severe osteoporosis at 55, right? What do we do? Are we loading up with deadlifts right away? No, it's no way. She's got a bad shoulder. If you're 75, just frail, it's like we're not doing deadlifts, guys. We're not. Well, we are. We'd be doing like 5 pound deadlifts as you've seen on some of our channels, but we're not doing heavy resistance stuff. There's just no way. It's not. It just doesn't make any sense for this population. So this is the issue when I create content for osteoporosis, we're talking to these three groups. It's going to resonate. Some of it's going to resonate for this group. Some of it's going to resonate for this group, and some of it's going to resonate for this group. But there's no general advice for everyone except to just kind of get stronger, right? Have to know where you stand before you pick up a weight, before you start doing anything. You have to know where do you stand. So important. So think about, tell me guys, where do you guys fit? Where do you think you fit in the spectrum? Do you feel you're in that 20% ready to go? Do you have an issue, or do you feel like you may fall in that other group where, again, we haven't given up yet. We just have to be realistic with where we stand so we can start to help you figure out what you need to do. All right. So have an honest conversation with yourself, not where you want to be, not where you were 5, 10, 15 years ago. Where are you right now? Right. Path's going to look forward, or it's going to look different depending on where you are. But I want you to know there is a path forward, no matter what group you're in. This might look different depending on your starting point. And we have to pick a realistic destination, but you keep making forward progress in the right direction. Cool things are possible, guys. We've seen it. Absolutely seen it. Shelly's between group 1 and group 2. Fair enough. Victoria, 20%, ready to go. Sounds good. Type into the chat, guys. Which group do you think you guys are in? 1, 2, or 3? Just so I know where our group is. All right. Laura's in the 60% for sure. That's where the majority of you guys are going to be. And that's where I think we're going to be trying to do content for everyone. But I think that's where we're really going to try to help people as to how to get into that 20%. And then what do you do when you're at 20%? Francine, how do we know? Whew. Need an assessment from someone that knows what they're doing is the easiest way. Jillian's in 2, Connie's in the 20%, Nancy's group 1, Marsha's ready to go, Catherine's in group 3, Jillian's in 2, Jill's in 60%, left hip issues, right hip osteopenia. Who do you trust to do the assessment? We're gonna be talking about that later, guys. And this is I don't have the answers yet. Audrey's in the lowest group. 60%, yeah. Sciatica, yeah. Group 2, you do not want to be doing deadlifts with sciatica, right? Not yet. Right, 60% with back pain, yeah. There's movement. You're not fixed at a group. You just need to be realistic with where your starting point is. So you don't jump to doing things you're not ready for, or you don't regress so back and miss this window where you could have done more, but you were scared. All right. Who do you trust with the assessment? We're gonna talk about that. We're gonna figure that out together, guys. Would I still be considered group 1 if I have negative 2.6 in femoral neck but no other issues? Yeah, I'd say you're in group 1, right? Group 1, I've been assessed by an Onero therapist. Yeah, Onero seems to be the um the leading group that's out there. They need to let it be more known to other people that they exist. I don't think as many people know Onero exists, and that's they're going to do more on that. When trying to find the right PT, I will talk about that a little later on, right? I will talk about that later on. I have some ideas of people that will at least give you a good starting point in terms of how well you move. I think that's the most important thing. Um, you got to move well before you move often. You have to be able to move before you can get into the positions to actually strengthen. All right. Thanks for sharing, guys. It was really helpful to know where you guys actually stand. So, Onero Academy has the location list. Yeah, but nobody knows about Onero. Right. Right. Close to 350. Yeah. Yeah. Worth it. Well worth it. Yeah, they gotta everyone's gotta do better. Everyone's gotta do better. We gotta get the word out for sure. All right, let's get back into we got still got a lot more to cover, guys. Okay. So before we start to exercise, we have to go over principles because, as we said, the research tells us what to do. It does not tell you how to do it. The how is just as important, if not more important, than the what. The the what is based on the science. The how is more of an art, right? You can't really, you're not going to find how to do it for each specific person in a textbook. It's impossible. But we can use general big picture principles to help guide us throughout this process. Number one principle needs to be on top of your mind. I've done a couple of videos on this. I'll probably do a lot more on this. Your body needs to move well before you move often. Quality of movement comes before quantity of movement. Always. You cannot load a foundation that's off. If you have one knee that's hurting and one that isn't, if you do a squat, what's going to happen? It's going to be asymmetrical load. You're going to shift weight elsewhere. You're going to compensate. If you have an old ankle injury, it's going to drive tension into your knee. Going to make your hip go out of place. If you have hip tightness, can you get your back in the right position? If you have tight shoulders, rounded shoulders, upper back stiff, can you get into a proper hip hinge position to get your back straight and aligned? Right? These are all the questions that you're not going to see in the LIFT-MORE trial. What does it actually take to get someone into this position to actually do the exercises safely? Number two, thoughtful, careful progression. You have to earn the next level. My fear in my hesitancy with putting content out there sometimes is that people might actually try it on their own. And I don't know people's starting points. Potentially dangerous. Don't want to be doing that to people. Right? I try to make very clear in the videos, especially when the clients are doing more high level stuff, it took years to progress them to this point. They didn't just walk in and start doing these things. So we got to be really clear about how to progress in a way that you're going to make progress. You're actually going to do it, but to make sure that you don't overdo it, potentially cause an injury or setback, which is going to derail the whole process. The last principle to always be thinking about, guys, train to feel good, not to feel sore. I don't think a lot of people are up to date on this philosophy of strength training exercise, and that it is possible to lift weights and your body actually feels good instead of this old no pain, no gain. I've got to feel sore and beat up. That is also a recipe for injury if you overtrain and not realize that you're overtraining because no one told you. Because if you are feeling sore, if you have to recover, if your body aches, you're not going to be able to train. And if you can't train, you're not going to be able to create the amount of consistent loading that's required. So training so that you can be consistent, you don't get hurt, you feel good, is going to be going too intense every single time. Always keep these three principles in the front of your mind if you're going to be doing some form of exercises. Does my body move well? Am I progressing thoughtfully and carefully? Right? Do I feel good after I train, or do I feel sore, achy, inflamed, and beat up? If you feel sore, achy, beat up, you have to reevaluate what you're doing, whether it's not right for you at the moment. If you feel good, right, let's talk about, can we progress? Can we start to inch the weights up? Can we increase the loading a little bit? Right? All case specific. So where do we start? Let's talk about a starting point, guys. I do not feel comfortable telling every single person, no, just start going to the gym, start doing squats and deadlifts and box jumps. Not without having a clear set of checks and balances to make sure your body can actually do these movements safely. So the first group of exercises that we want to talk about conceptually are foundational exercises. And this is a starting point I think that every person in all three groups can start with. Group 3, again, severe osteoporosis, more frail, just have a lot more ground to make up. You can start with foundational exercises for sure. Group 2, absolutely, foundational exercises. Group 1, sure, make these part of your warm-up. You'll learn a lot more about your body, especially if you, again, these foundational exercises I think are just appropriate for everyone. Because these foundational exercises, as we'll get into them, they are not just warm-ups, they're not just exercise that you do. They are diagnostic tools that we use for our clients to see if they are ready for the next step. So things like, can you feel your glute muscles in a glute bridge? Are your glutes firing? Right? If they are firing, cool. We can maybe start to entertain the idea of doing some deadlifts. If they're not firing, oof, glad we figured that out in the bridge before we started to put a kettlebell or a barbell in front of you, because your back and your knees are just going to really suffer if you don't have functioning glutes. Right? How about your core? Your core muscles. The core is the foundation of everything you do. Protects your spine. If your lower back arches on an exercise like a dead bug, you can't brace your abs, you can't feel your abs. I don't feel good putting a weight in front of you. Not yet. There's no way. Foundation exercises also give you a low stress way to see if your body compensates. Can you move your hip without arching your back? Can you keep your back straight while doing a plank? Can you lift your arm and your leg at the same time while maintaining a neutral spine? Right? If you can do these things, great. We feel much better about you going to the next step. But if you can't, well, it's a damn good thing we found it here in these kind of foundational exercises before you started to load it up. So with foundational exercises, the goal is to help people reconnect to their bodies. And I'd say we're talking to people in group 2 and group 3 with this whole concept of connection. Now, a lot of people in group 1 too, because a lot of people have these imbalances. They don't realize they have it. So for those that have not moved consistently in years, your brain and your body and your nervous system they've stopped talking to each other. We see this every single day when someone comes in with pain or injury. They can't feel certain muscles. They can't feel their glute. We tell them do a glute bridge. They feel in their back. They can't feel their glute. They can't feel their core. They've got back pain. They cannot feel their stomach muscles working. Every day, this is the clientele that we work with. It's a connection problem. They have the muscle. The muscles aren't dead. They just literally can't connect. Send a signal from brain, make muscle contract. They can't do it. Not yet, anyway. Right? So these exercises give us a way to determine what works, what doesn't. If you can't feel it, it's not a failure. This is our starting point. This is where we need to start. In these foundational exercises, we're going to go over some. A glute bridge, a bird dog, a dead bug. These exist to just as a set of checks and balances to see, can you feel and contract the important muscles that need to be working for these exercises? We do it on the floor. Can't fall because you're already on the floor. Can do it in the bed. Easy to do, appropriate for everyone, no matter what stage you're in. It's not a detour. It's a foundation that makes everything else safe and just makes sense. So we have some clients, they're here for months, rehabbing, reconnecting, getting rid of the injury before they even touch a weight. Months. I know that, again, 8 months, you can lose a lot of bone, but you can lose a lot more if you get injured before you even are out the gate. But once we get that foundation right, these clients progress and they can progress really fast. You're one injury away from losing months of progress and ever having the chance to build bone. The foundation stage is not slowing you down. It's protecting your entire investment. Simple. You'll see them on our Facebook page and our Instagram page. You'll see it everywhere. 3 exercises, a glute bridge, a bird dog, and a dead bug. A glute bridge. Can you feel your glutes? Do your hamstrings cramp? Do you feel enormous tension in your quads? Does your back arch? Simple things anyone can get started with, right? A glute bridge is going to be clearance for things like a deadlift, a hip hinge. It's the same movement, right? If you can't feel it here, you're not going to feel it standing with the weight. If you feel it in your back when you do this, you will feel it in your back when you lift the weight, right? If your quads are so tight, pulling you forward, they're going to pull you forward when you're standing up with a kettlebell or a barbell in front of you. Your back is going to pay the price for that, for sure. Right? Not saying this is scary, guys. This is just what we see every single day. Glute bridge, super important. Bird dog, checks and balances for shoulder mobility, hip mobility, maintaining a relatively neutral spine, core tight, shoulder stability, hip and balance stability on their side. Looks like a simple movement, but we get so much information from our clients of if whether or not they can hold a bird dog or not. It's insane. It's so informative. Just try it on your own. All fours, one arm up, one leg out. Keep your back completely straight. Keep your core locked in. This diagram, that back is arching a little more than I'd like it to. Try to keep that thing as flat as possible and see if you can hold it for like 5 seconds. All right. If you can't, well, there's your answer for your starting point. Get good at these before you start doing your lunges or your box jumps or whatever whatever it is we see people doing. Right? Do you have the ability to, maintain posture, balance, and integrity in this position on the ground before you start asking yourself to do it with a weight in your hand, standing? Does that make sense, guys? A dead bug. This is a test for core stability. Does your back lift? Can you control your stomach? Do you have the ability to maintain a flat, neutral spine on a mat with just an arm and an opposite leg? Right? Simple stuff, right? But these exercises are hard. They're really hard, especially if you're doing really slowly. If you try to hold it, these are not just like basic exercises. They're a lot more challenging than they look, and they give you so much information about the current state of your body than, again, just picking up a weight and having no idea are you doing it right. Foundation first. And there's other movements to this. These are just the three that I picked that I think would be an appropriate starting point for pretty much every single person. Can you do this and maintain form? And does it feel good? Can you feel the right muscles working? If it can't, got to figure out why you can't. All right, stage one was the foundation. Stage two, got to learn the movements. Most people skip this phase. They watch YouTube videos. They see our PDF guides. Oh, I got to do deadlifts. They see generic routines. All these things assume that you already know how to move. For this population, that assumption is not just wrong, it's very dangerous to assume that people know how to do a deadlift. This is the stuff I wrestle with when I post content of people that we've taught and trained for years, that people are going to take it the wrong way and just start doing it. That's why I hesitate every single time I press upload. But when I see people jumping off of boxes with trap bars and landing viciously, I feel a need to at least put some of my stuff out there to not say that that stuff's bad. It's just, as we said, it's just not going to be for the vast majority of people. And to think that people think they need to do that stuff is it's pretty concerning, right? Um, we'll talk a little bit more about that. But strength is a skill. It's not just something you just walk into the gym and start doing. You have to learn it, like riding a bike. It's a skill that has to be learned. You have to be aware of your body. You have to be knowledgeable of joint positions, muscle engagement, position of your body, how to breathe, how to feel tension, how to create tension, how to contract your muscles, how to finish, how to set up. There's so many things involved in doing a lift. You can't just go in and lift. You have to learn to do it. If you skip this phase, it's a serious condition, osteoporosis. If you have other injuries, can't skip this phase of learning the movement. It's so important. All right. So this is what the struggles are actually like. This is what we work with every single day, one-on-one. We have patients right now. They're in their 60s. They're in between that bridge of stage 2 and stage 1. They want to get to stage 1, but they know they've got something and they don't feel safe doing it. Right. Sorry again about this light, guys. I will have to do something about this light that keeps going off. So what's going to happen in this stage? And these are all very normal things and to be expected. You might struggle to feel the right muscles working. Completely normal. You can't tell if your body's in the right position. Yep, absolutely. Your back might feel tight before you even add load. Good to figure it out before you start to lift weights. You may figure out you have imbalances that you didn't know existed. Like you can do a bird dog on one side easily, but you can't hold it for like a second on the other. That's something worth investigating. And it's good to figure that out then before you, again, do the movements. When we're teaching you how to do a hip hinge, you might be compensating it around an old injury without realizing it. Most common thing we'll see for someone like we're teaching them a squat and they can't get down all the way. Their knees hurt, their back hurts, their hips feel off. And it turns out that the reason why they can't do the squat has nothing to do with their knees or the hips or the back. It's because they have an ankle injury that they had like 15 years ago, have like 30% less range of motion on that ankle that's driving all these compositions to the other side, right? These are the things that we figure out in this learning of the movement, that we have to test these movements on people before we start to load them up. And this is where we figure it all out. They might feel the wrong muscles. They might feel the right muscles. They might be 60% there with a squat, but it might be 80% there with a deadlift, but like 100% there with a plank. So maybe we'll build their upper body first. We'll start to maybe go a little lower on their lower body stuff. Again, this is the arts, guys. This is where case by case, person to person, this is where it matters, right? What bothers me, what worries me is that when people read lift more and say, I have to lift heavy, I have to do deadlifts, I have to do squats, I have to jump. Yes, you do, but you also have to earn the right to get there. And I don't see a lot of people talking about what it takes to get to that point because it's very complex. It's very hard to explain. You can't do it in a 3 minute clip. It's taking me hours right now. We're still, you know, we're gonna go past 2 hours, guys. I hope you guys are ready to stay on with me a little bit longer than 2 hours because we still got more stuff to cover. We still have some Q&A after too. Does this make sense, guys? Is this resonating with you? Is this helpful? By scaring you, or is it guiding you? All right. Let me know. Is this helping? All right, very helpful. Good guidance. Thanks for the feedback. This is what we see every single day. This is the in the trenches working with patients trying to do this stuff. This is what we're doing right now. We'd love to just start slinging kettlebells around, guys. You have no idea. We'd love to do that for people. It's just doing a deadlift properly is hard. It's very hard. It's very hard. But we have if you see our if you see our channel, guys, we have people with severe osteoporosis, have never picked up a weight, and they're lifting a 5 pound weight and they feel good. It helps them. They feel stronger. They're more upright. It's helping them. So the cool part is these exercises are going to be appropriate for pretty much everyone across the board if you can just learn to do them right at a level that just makes sense for your body. All right. And if you can progress from there, then great. If not, that's okay. Just make sure you feel good when you do them. You don't feel off. All right, let's continue. A bit scary too. Yeah, a healthy amount of fear is you have to have a healthy amount of fear going in so you can respect what it is that you're doing. All right. I'm scared every time I have a client that is healing from a herniated disc, severe sciatica, the first time they lift a 10 pound weight. I have a little bit of fear. All right. You have to. You can't be not scared of these things. You have to give it the respect that it's due. But if you can overcome it with strategy, with good technique, and it feels good, that's what's going to disarm that fear. Right? That's why we're talking about what it takes to give a healthy amount of fear to what it is that we're dealing with. We don't want to scare people from doing it, but I'd rather people be a little bit like take a step back and analyze the situation and try to figure it out than going full steam ahead and causing an injury that could have been avoided had we not, talk about these stuff a little bit more. As I said, we may stay here for months, months. Again, I know we may be people like they feel like they're running out of time. And lift more 8 months, we saw people low intensity program losing bone within an 8 month period. Totally respect the fact that people feel the need to do something now, but we may stay in this learning phase for months, guys. Many of our clients, we stay here because the movement's just not there. They may be some in some areas, but for others, it may not be. One injury, one single injury will equal weeks or months lost. And People may never even get back on the horse after an injury. And then it's like, now what? You know, you lose a couple weeks, that's bone not being built, progress being lost, muscles being wasted. So if you have patience now, you have years of safe strength training ahead. Our clients, as you'll see, Pam and Julie, they haven't had a pain or injury that we've had to worry about in years, right? They came in with pain and injury. We stayed at the stage for months, taught them the basics, made sure we checked all the boxes, and just slowly built up 5 pounds here, 5 pounds here, 5 pounds less this week, regress for a month before we go back up. These are the careful decisions that we make for specific to each person. It's really difficult to know. This is hard, but it's doable. It's just hard, right? Again, you're one injury away. Stay in this stage longer. It's not, you're not falling behind. You just want to make sure you can stay in the game and have that good foundation before you start to load up. You said this is where the real work happens, identifying compensations, correcting movement patterns, rebuilding the mind muscle connection, and figuring out mobility imbalances, that tight ankle, that stiff hip, that shoulder that's a little tight, the knee replacement on one side that's like a little bit healthier than the other side. People coming in to see us with hip replacements on one side, they've got tight hip on one side relative to the other. It's going to asymmetrically load their back. These are things that need to be cleared first before we start loading them up. Right? It's real conversations, what we're doing right now in clinic. And we just want people to be aware of these things, that these things exist. And this is the path to make sure that you're going to do it safely. You need to move well before you move often. Probably one of the most common questions I get is people, they want me to give them a 20-minute program, upload a 20-minute program where I can just plug and play and follow. I get that. I want to do that. I want to be able to deliver for that. But in good conscience, I cannot hand this to everyone without knowing somebody's starting point, right? Because 20 minutes I do of an exercise, then I have to say, well, here's what you do if you have tight ankles. Here's what you do if you have a stiff hip. Here's what to do if your back can't get straight. And then 20-minute video turns into a 3-hour long video talking about full-on anatomy and physiology and biomechanics. So it's very hard. We'll try to do it anyway. But these are the things that we want people to be front of mind, especially if you are in that middle category. And again, this is just what we do every single day. So let's talk about the movements, all right? Let's stop talking about fear. Let's start talking about let's start talking about something more exciting now. Let's talk about what to actually do. All right. Again, now that all that stuff is out of the way, we've gone over the pharmacology, we've gone over the science, we've gone over what can go wrong. Let's be a little more positive thinking. Let's talk about what can go right. How does that sound, right? Let's start talking about the exercises. Can we start doing that? This is what I really wanted to talk about. All right, but now that all this stuff's out of the way, let's talk about how to actually do it. Yeah, let's do it. So we talk about learning the movements. What are the movements? Let's try to keep it as simple as possible. We're going to go over 5. The squat. The ability to sit and stand safely is a fundamental life skill. It is one of the most impactful movements that you can do to load bone, and you need to own the movement. Full control, neutral spine, knees tracking over the toes correctly, good hip range of motion. All right. Here are the common problems that we may see that might get in the way. If your heels rise, you might have limited ankle mobility. There's workarounds there. Just have to know that there are. Excuse me. If your knees start caving in, yeah, you might have tight ankles, weak glutes, poor postural control, things to look out for. Make sure you don't end up with worsening any knee joint pain that you may have. If you have excessive forward lean, or if you can't maintain straight alignment with your spine, it means your back might be stiff. You might have tight shoulders. You might have tight hips. If you have one side that goes lower than the other, you might have a knee or hip imbalance, arthritis on one side, or things like that. Just things to look out for. But a place for most people to start: sit, stand, learn the movement, stick your butt back, touch it on the chair, pop right back up, and see if you can do so with control, with integrity, right? This is where we're going to have a lot of people start. Now, for range of motion, You've seen it on our videos. We love the TRX straps. Lets you offload some of your body weight, helps you explore some of the depths of your range of motion. Got to be careful with your breathing. Don't exert yourself. A lot of people, from the public floor world, say that deep squats can be dangerous, and they can be, especially for things like pelvic floor prolapse. To make sure that you go slow, don't like exert yourself in terms of creating too much pressure. What's called a Valsalva maneuver, which can increase your intra-abdominal pressure, could create things like pelvic floor prolapse. Don't want anything of that to happen. To make sure you have a nice exhale on the way up, but don't just exert your pressure and try to strain yourself getting up, especially if you're going into more of a deep squat position. All right, but this is again a fundamental movement pattern, assisted squats, sit stands, starting point for pretty much anybody, regardless of your level. If you're level one, good to go. Still make sure you can do these things. Make sure you have good range of motion. Your joints feel good when you're in a deep squat with a TRX. Make sure you have the control. You're not shifting towards one side compared to the other in a sit stand. You can learn a lot about yourself just doing these exercises, especially if you're just starting out. Right. If you don't have straps, you can hold on to a kitchen counter, you can hold on to a door frame, just something to hold on to, right? But straps, I think, are also a great investment if you're going to do something like this. Okay. So there's a squat movement pattern. The hinge, deadlifts, one of my favorites, right? Definitely one of my favorites. A lot of people, they have knee pain, they have knee issues, they've got some knee arthritis. Um, and it's really hard to force everyone to squat. But, and quite honestly, not everyone's going to get to a point where they're doing deep squats. It's just not going to be feasible for a lot of people. But that doesn't mean you don't do it. That doesn't mean you don't do something. So the hinge is one of the best exercises because it's easier on the knees and you get just as much, if not more, loading through the femur, through the hip, and through the spine. All right. Most important part about the hip hinge pattern is you're pushing back through the hips. You want to create tension through the hamstrings, into the glutes, and into the spine. We teach it almost like a bow and arrow, where your hips are the point of the bow where you are driving tension back. The more tension you release through the hips, the more power you're going to get, and then the weight just goes up. Most important part is you get your spine as straight as possible in one straight line. This is called a neutral spine. Your spine is going to be a nice, safe, strong, protected position. It's going to be very hard to get injured if you can maintain neutral. However, most people that we see, because of today's society, shoulder tightness, phones, posture, computers, tablets, are going to have a lot of rounding in their mid upper back, like here. Right? That's where you really need to focus on trying to sink that mid upper back down to make sure that you're not creating too much pressure in this lower back here. See a lot of people, encounter a lot of people. We've assessed some people here. They've got a little bit of a hunchback in the mid part of the back. So when they do a hip hinge, there's a lot of pressure and hinging that develops right here. That's where we've seen quite a few fractures develop. T10, 11, 12, L1. Fracture can happen right here if you have a hunchback or stiffness or rounded shoulders up here. You need to develop mobility in this area. You got to be able to feel the mid to upper back area sink down and get straight so you can equally distribute load throughout your entire spine before you lift. We have videos on our Facebook and our Instagram going deeper into this, and I don't want to spend too much time on the details of how to do it, but this is just what to look out for. And you can do it now without loading the weight. You're not going to be punished right now if you try to just do this with no weight, right? The risks are a little lower, but you'd rather practice it now and see, do it in front of the mirror. Can I get my back straight? If you can't, if you have some issues getting your upper back to sink down, that's where you would probably need to spend time first. If you have a lot of hamstring tightness, if you just can't get down, maybe you have to start from a little higher up from the ground. So there's so many different modifications, regressions that might need to happen, again, before you start to lift. Once you feel you can get into safe position, start with like a 5-pound weight, right? Uploaded that video just last night, right? Neutral spine, hips back, knees out, chest up, back straight, right? Lots of things to think about, but that's what makes the exercise so important, especially in this phase. You want to be thinking about your movement. Think about, what are my hips doing? What's my back doing? What's my core doing? What are my shoulders doing? The more you think about your body when you do these exercises, the more you're going to regrow those connections between brain and body. We have better connections from brain to body. Your body's going to start to tell you, I feel off here. I don't feel good here. I can't feel this. This is where you want to start to discover what is your body actually capable of, again, before you start to load. All right. This is more tangible, practical advice. All right. Again, make sure you don't squat. Make sure you don't bend your knees too much. This is a hip hinge. Stick your butt back. All right. Is that clear? Does that help? Hip hinge. All right. Couple other movement patterns. For the sake of just getting through this presentation, um, it's in the guide, guys. You guys downloaded our bone guide, right? There's a push, there's a pull. It's in the guide, and we're gonna find more stuff in the channel. But I want to get into some more stuff. All right. So now that we've gone over, just we'll pause here for a second. Any questions about squat and hinge? Right? Does that make sense? Does that make sense for people in terms of what we look at clinically? Safety, mobility, able to do it, right? Before we get into the really fun part, let's take a quick second. Does everything make sense? Everything we've gone over. Do we need any clarification? Any questions about like a squat or a hinge? Makes sense. Thank you guys for sticking around, by the way. You guys have been with me for 2 hours now. Very helpful and promising for those that have knee problems about the hinge. Yeah, a lot of people are going to run into knee issues. I would pick the hinge. You got to get that back straight. You got to get those hips back and make sure you don't put yourself in a position where you can create compression or too much force in that upper lumbar, lower thoracic spine. It's something we see a lot. It's got to be careful. And I want to be encouraging to you guys, but we have to earn the right to get to this next point that we're going to get to. We're going to start doing the fun stuff. Shoulder issues, rotator cuff tears. Yeah. We're gonna do more. We'll do more. Where can I find the guide? Um, it's just do you have you guys seen us on Instagram or Facebook? It's people just type bones in one of our our videos. My bot will send you the guide. You can download it. That's where the guide is. It's a 37-page PDF. It's got all the exercises in there, written in instructions, 5 movement patterns, regressions, progressions, and things like that. Cool. All right. But yeah, I just want to make sure, does that make sense? Is it clear? All right. I don't want to get too clinical, but I feel this is just what we do every single day. This is just how we approach the triangle block thing so I can do a deeper squat. I'll post it in the Facebook group or something like that. I will yeah, Paula, just I can't do it right now. That's I will make sure people have the link to all of our guides and all of our resources. Posture problems, check in with the PT first. Yep, absolutely. Absolutely. Posture problems, number one thing. So the person that asked about shoulder rotator cuff tears, most of the time is due to stiff thoracic spine, rounded shoulder posture, messing with your ability to lift overhead, creates impingement right here on the top of your shoulder. The upper back, that shoulder needs to clear before you go above head. Try to download your guide, but it says web address not found. I will make sure I double check to make sure that URL is still working. Again, as we said earlier in this presentation, it's just me, my wife, Austin, and Teddy. And unfortunately, Teddy is not tech savvy. So just give me a little time to make sure if there are any tech issues with our stuff getting out there. Just leave them in the comments or just let us know, and we'll make sure everybody has access to our free resources. Okay. All right. So any more questions before we get into the last area? Any other questions? Yeah, Jane, again, the guide, I will send an email out to everyone. People were asking about the guide. I'll make sure that you guys have the link so you can download it. It's a pretty big file. It's a pretty big PDF, so I can't send the guide directly to email. So it has to be downloaded from our server, from our system. So that's why it might take a couple steps for you to get there. But again, I just can't send it directly through email. So, all right. So any questions about, again, lunge or, I'm sorry, hinge or squat before we go on? Hip hinge safe for femoral osteoporosis. Yep. Yep. Absolutely. Probably the best one for it. It just depends. Can you do it? Get in the right position. Does it feel good? Do you feel in the right areas? Right. These are the things that are more important questions to ask than is this exercise good or is it bad? All the exercises can be good. It just depends on if your body can get to them. How about prior back surgeries? Gotta get assessment. We're gonna like we have people doing some form of lifts with back surgeries. It depends on the surgery, depends if it's a fusion versus a laminectomy versus just a microdiscectomy. There's so many different types of back surgeries. It depends on how many levels. These are the conversations that we would need to have with a surgeon and a physical therapist. Definitely something that you would not, it's not a no for sure. We've seen people that can lift pretty heavy post back surgery, post back fusion is possible, but that is something that I would not want to do on my own for sure. Right. Flat back surgery, microdiscectomy to it. Yeah, it's yeah. So it's always possible. Again, we've seen people with severe back injuries, surgeries get back to a point where they're deadlifting and stuff. So it's definitely possible, but not without clinical supervision. Something you would not want to do on your own for sure. Right. All right. So let's go on to the last section. Right. All right. So a little before we get into the one last thing. every the reason why it's so hard to give people a 20-minute exercise program and say this is what you need to do it every week, twice a week, as much as I want to, that it's not the exercises that makes or breaks your progress. It's the feedback that you get from doing them session to session, week to week, month to month. All right. This is not a do 5 sets of 5 and go home. Real clinical decisions are made every session. Because was that weight that we did, was it too much? It may have felt good for the first 2 sets, but in that third set, I felt a little twinge in my lower back that lingered for like 24 hours. Oh, I did that squat for the fourth time. The first 3 times was good, but man, my knee's a little swollen after that fourth session. And then the movement just felt a little off the following day. If that happens, maybe we did too much, so we need to regress. We need to back off a little bit. Or the person came back and said, I felt good. I wasn't tired. I slept fine. My body feels exactly the same. And okay, maybe it was ready for more. Maybe we were too cautious. So then we again advance to the next step. Was it right? You felt the work. You could finish the rep with good form. You felt good. We might stay here for a little bit, let everything adapt for a couple of weeks before we start to move up. Or, as we said, maybe some people are going to be ready in some areas. Again, we have a person right now. She's really making a lot of improvements in her upper body strength. Her plank, her shoulder range motion is all improving, but she's got some like lower body imbalances. She's got some hips that are off. She doesn't really quite really feel good with her squats yet. So for that person, again, she might be doing more upper body for a couple of weeks, and we might be doing more regression, more rehab based work on the lower body. So again, that's where context is really difficult. That's where it's really important. All right. But that's again, these are just the decisions that need to be looked at when talking about a safe progressive program is based off of the feedback. How did you feel? If you felt really good, maybe stay there for a couple of weeks before you progress, or if it's just really easy, then maybe it's time to increase. Right. The progress is going to be individualized. It can change from session to session. So just things to keep in mind as you guys are, trying to do this stuff on your own or working with someone to help you do it. How do you feel after the workout? All right. So let's so audio doesn't work. So let's start talking about again. So we started talking about the general movement. So let's start talking about some of the fun stuff, guys. This is what you guys are here for, right? This. Let's talk about actually the bone building exercises, the cool stuff that everybody watches. All right. Do we want to do some breakdowns of the movement? All right. Do we want to break down the infamous or the famous Pam's goblet squat? Look at that. Full depth. Let's pause it right here. First thing to be clear, it took about 3 years to get her to this point, right? She did not walk in and start doing goblet squats. 3 years. 3 years. Years. Not 3 weeks, not 3 months, 3 years. All right. So please let that sink in. Heel wedges, it just helps with center of gravity. It just helps people get lower into the squat. I like the heel wedges. Obviously, good hip range of motion to be able to get deep down. We worked on it with the TRX for years to get her comfortable, confident getting that deep. Knees obviously got no issues with knee range of motion, full flexion. Her butt can touch her calf. Straight back, good alignment, right? She's not under any duress, not under any pain. It's effortful, but she's not like forcing exerting herself, which again can be dangerous if you're doing a deep squat, pelvic prolapse. Definitely something to watch out for, right? Driving up through the heels, standing up nice and tall. Nice. How's that? So we spend 2 hours just to get to this point, but that's the point. All these things that we talked about beforehand is what gets her to this point where she's doing a deep squat, full load, full range of motion, right? Does Pam already have osteoporosis? Not anymore. Not anymore. She's back into osteopenia, hip and spine. What degree are her knees when she goes down into the squat? Full. Audrey, how are your knees? Yeah, the I will share Paul, I hurt looking at it. All right. Judy, though, I'm just gonna read back in the chat. Old no pain, no gain is incorrect. It is incorrect. Yeah, I will make sure again the audio is not that great. I will figure I don't want to futz around with it too much more. Is it possible to regain ability to bend knees all the way? It's possible. That's where the clinical stuff needs to be. It's hard to answer. Good job, Audrey. Yeah. So heel risers, I like them. I like them. Right. I don't think they compromise the movement so much. I don't think it's cheating. I think it really helps a lot of people. But you got to do your sit stands. You got to do your TRX squats. You got to be able to do them without weights before you do them with weights. Just common sense, guys. All right. The principle is the more range of motion you can get into an exercise, the more muscles will contract. The more the muscles contract, the more compression is going to happen through your bones. The more compression you get through your bones, the stronger they'll get. Right? Range of motion, form, mobility first. Right? That's what we see. Right? Goblet squat. Not everyone's going to get there, but if you can, man, this exercise feels good on the body. It feels good on the joints. It feels good on the core. You just kind of feel everything working together. It doesn't, again, exercise to feel good and feel it everywhere. Don't feel it building up in just one area. Right. But this is the what happens when you check out all the boxes that we talked about for the past 2 hours. Move well before you move often, learn the movement, make sure the muscles work, make sure the joints have enough mobility, then you can just enjoy. Right. The hard work is earned. But you get to this point, this is where the real compounding gains and real progress starts to happen. How about some deadlifts, guys? Some double kettlebell deadlifts. Do we want to see Julie lifting 100 pounds? That straight back, hips back, good posture at the top, good exhale on the way up, maintaining form integrity the entire way, every rep. Lats locked in, protecting the spine. It's going a little more than 5 reps. We got to get heavier weights for Julie. That's the issue with Julie. She's getting too strong. We got to get heavier kettlebells for her. The lats lock in every single time, bracing the spine, more pull. One more. One more rep. Ten reps. Whew. What do we think about that, guys? That has to be a no-no for precarious backs. Yep. Yep. Precarious. Yep. That's the whole point, guys. See how she maintained the straight back the entire time? She used all of her muscles, breathing. The movement look the same across all reps, right? So she has the muscle memory of what the movement's supposed to feel like. This is what happens when we spend 2 hours going over boring, basic stuff that no one wants to talk about. This is the result of doing the boring, basic work. Move back to Rhode Island. Yeah, right. That'd be, I miss it, but it's better out here. All right. This is what's gonna build your bone, guys. This is what we need to help people get up to. This should go from porosis to pina. Some people let us share their stuff, others don't. We're not gonna share things that haven't been able to disclose. So appreciate the question, but can't disclose that. But this is what it looks like. 66 years old, definitely in group one. All right, this is what group one looks like. Move well, good form, owns the movement, good integrity, good form. Her body's talking to itself. She kind of knows when it's too much. She knows when to ease back. We're watching her, right? Pretty significant amount of weight, right? It's not nothing. Any questions about the deadlift, the kettlebell deadlift? Osteoporosis involves loading the bones. How is this different than loading the bones with free weights? Great question. Um, the weights force the weights force the muscles to contract in a way that body weight or free weight or just cannot. You you have to generate so much tension and contraction and control across all of your joints, all work together as a unit with the weight. With the machine, you can get away with just working a muscle. With the machine, you don't have always the gravitational of ground reaction forces from the ground going up. You're not getting full body muscle contraction, full body stimulus. Weighted vests, I like them, but the same principles must apply. Um, Weighted vests might be actually good for someone, for example, that can't get into certain positions, but can walk, they can hike. Maybe a weighted vest is a good way to just kind of load the skeletal system without having to get your body into all of these different postures or positions that it just can't. So we don't want to exclude people from trying. So maybe I see a weighted vest as having good possibility for just kind of weighted walking or something like that, or to help you just exercise within a range that you feel comfortable and confident in. Right? Does that make sense? Right. Any other questions about the deadlift? You guys want to see a couple more exercises that will actually move the needle for you? Lift more talked about an overhead press. Also, one of my favorite exercises. Love this exercise. How much weight? Again, I don't know. You probably want to start with just 15 pounds, to be honest. Just walk around the block a couple times. That's usually enough for you to start to feel it. Just start light, start somewhere, start light, go for a walk for a block, see how you feel, and then progress very slowly and gradually from there. 15 pounds, I think, would be 10 to 15 pounds, always a good place for people to start. All right, overhead press. Let's take a look. Boom. She's getting ready for bat wings. She calls them her bat wings. All right, we're getting rid of them for her with these. Full range of motion. You get full range of motion at the top. Those weights are actually loading through her shoulders, through her humerus, through her scapula, down into her spine. Look at her back. It's straight, core is tight, glutes engaged, vertical alignment. She's not arching back. She's not compensating. She's not off. Her shoulders out in front. The person that asked about what I do about rotator cuff, she has a rotator cuff tear on her left side. She started with us. She couldn't lift a cup over her head. 15 pounds up, easy. Why? Got the range of motion back in her upper back, got her shoulder range of motion back to be able to go full. And we taught her how to not just lift from her shoulders, but to lift from her scapula, the foundation through here. There's a technicality to these exercises that must be taught. Again, as we said, you have to learn the movement before you load them. We taught her the movement. Make sure she had made, and step one, move well before you move often. Shoulder range of motion, get above the head. Make sure she doesn't have pain or pinching in her rotator cuff. We had to do a lot of work on her upper back. We had to do a lot of work through her shoulder girdle. We had to do a lot of work on opening her pec, her bicep, to make sure she had full range of motion. Step two, learn the movement. Make sure she's not lifting from her neck. She's packing her shoulder down through her shoulder blade. She doesn't feel it on the top of her shoulder. She doesn't feel it pinching where her rotator cuff is. She feels it on all the muscles, contributing to compress and to stabilize her shoulder before she picks the weight up, while also making sure she does not overarch her back. She doesn't cheat by, again, leaning backwards. Everything is upright, good form, good integrity. That's where 2 hours of boring prep work gets us to the stage where you start to do things that move the needle, that feels good, and they feel safe. 15 pounds in each hand. If you feel your back during shoulder press, can you modify this exercise? Yeah, I would say that you need to find a way to see if you can restore range of motion without arching your back before you start to do this. If not, you have horizontal press, like a chest press or something like that, straight arm plank, right? There's modifications to everything. They should be straight overhead. Yes, not slightly forward. Slightly forward is going to create those rotative cuff tears, guys. It's going to create a lot of pinching in that supraspinatus tendon. Straight up, slightly backwards. Can do one of overhead if one shoulder has a little less range of motion. You got to get that range of motion back first, Robin. Or it would not, I would not do an overhead press unless you have full range of motion. Am I versed in reading DEXAs and Qs and I have a lot of yeah. I don't have the time nor capacity to be able to advise people one-on-one right now. As much as I would like to. Um, farmers carry is great. We have a farmers carry coming up. I put the shoulder press in because it's part of Lift More and it's one of my personal favorites. But I also put it because it's just not going to be accessible for a lot of people, and that's what's frustrating about the Lift More trial, where people are expected that these are the exercises that they need to do, and most can't. Again, 80% won't be able to do it, and that's 80% of the people. So we just put 80% of people on drugs? Like, no, no, there's other ways to modify this. We're just kind of showing you what it takes to get to this point, knowing full well that a lot of people can't, but we're going to try to help people figure out how can I get to this point where I can start doing this stuff. That's where I really want to help people figure out how to get to this point where you can actually do this, not just do this exercise 5 by 5. How do we get to a point where you can do it safely without hurting your rotator cuff? Or if you do have shoulder arthritis, or if you do have things that are just not going to allow you to do it, then what are the right modifications that you can do so you can still do things like this without just kind of giving up? All right. So that's, again, want to show you guys what's possible. Not gonna be there for everyone, but if it's not there for you, there's ways to modify it. There's ways to regress. We want to keep doing more content for you guys. So just tell us where you're at and we'll be able to figure this stuff out. Kettlebell swings. Do we want to watch some kettlebell swings? Let's watch the swing. 50 pounds. Eight reps. The swing is the apex movement with for kettlebells. It's a deadlift, it's a hip hinge, and the reason why it's so effective is because the weight accelerates with gravity, which significantly increases the forces through the spine, through the hips, and through the femur. This is not going to be for the vast majority of people, right? Julie has a good baseline. She has some experience weight training before. She maintains good form, good integrity, good breathing, good hinge. Most important thing is she doesn't feel any pain after she does this. She just feels generally worked, but she feels good while doing it. Again, principles. Move well before you move often. Good hip hinge, good spine mobility, good back hip mobility, right? Learn the technique. She can deadlift 100 pounds, maintain the form integrity. She can start to swing 20 pounds and see if she maintains same form and same integrity. Are kettlebell swings considered impact training for the bones? Yep, absolutely. It's not your jumping, your heel drops, that type of impact, but it is as high potency in terms of effectiveness, but care and caution, guys. I've seen a lot of comments. People said they started doing kettlebell swings and fractured their spine. I could see it. I don't feel good recommending this for a lot of people. Again, for Julie, a couple years, safe, slow, guided progression. It feels good, doesn't feel pain. Slowly progress. Any questions about the swing, guys? You want to see a couple more exercises? Any other questions? Heel drops. We'll talk about the impact and plyometrics. So if we talk about Wolff's Law, the lady kicking the trees, it makes all the sense in the world to create some type of impact. The research supports it. People are doing it. I would not base my entire program on those alone. The thing about the heel drops is um it's hard. The thing with weightlifting, the thing with resistance training is you get real-time measurable physiological just data about your progress. If you're lifting weights and you feel yourself getting stronger, you're lifting heavier, you can do more sets, you can do more reps. That is like immediate feedback that what you're doing is right. And that if your strength increases, the likelihood that your bones are also increasing is very high. No guarantee, but if your strength increases gradually, no injuries, no setbacks over a long period of time, then the chances that your bones are going to get stronger as your muscle gets stronger is very high. The issue I have with the impact heel drops alone is that although physiologically it makes sense to do them, you don't always get that feedback of are my muscles getting stronger along with my bones. And for someone that is doesn't have a good understanding what their baseline is of strength, of mobility, of function, of their body's ability to absorb and react to stress, it it wouldn't be my starting point, but it's definitely, I'd say, part of the program more specifically geared towards stimulating bone growth. A heel drop is someone that just kind of if this is your if you're standing, if this is your heel, you come up and you just kind of just drop your heel onto the ground, just creating impact through your skeletal system, right? It's like it's a jump without the jump. Wouldn't you want to build strength before doing impact? 1 billion%. That's the point I want to raise about the stuff that I see. Again, I'm not sure how much stuff you guys see online. I see a lot more than I care to nowadays. We see people say, "Oh, these are the three best exercises for bone growth." They do a goblet squat, they do a deadlift, and they do a heel drop, but they're not giving any context why and what it is about. The message I want to get across to you guys is just stick to good strength training principles, keep things safe, and just progress slowly. Yeah, the jumping lead, it's ridiculous, right? That's it's too much. It's not necessary, and that's potentially dangerous. And that's again, I think people have good intentions. I don't want choose to call anybody out, but when I see stuff like that, that's not for most people, and I think it's just not necessary. It's too much. It's too much. And it's not for the vast majority of people either. Impact, plyometrics, jumping jacks, jumping back and forth, step plyometrics, heel drops. It all makes sense, but only after you've built a good foundation of everything we talked about, move well, have good awareness, get strong, have good balance, understand your own body awareness. These are all the things that I think are way more important to establish first, especially in the beginning of a training program. You get to a point where you're doing stuff that Pam and Julie are doing. Yeah, we can do some heel drops. We can do some plyometrics for sure, but not just starting off. I don't know. All right. We can have discussions about that. I'm not sure what um, people in coming from different philosophies say about those things, how immediately impactful they are, how much when to start doing them, if you can do them without having a good baseline. It's just I think that it's more important that people have an understanding of their bodies, of their movement, of their current strength levels, and build that up. And then those things can come along the way to speed up the process, but only after a good foundation of strength and mobility has been established first. That's my take on that, if that makes sense. All right. If you have an elbow injury, is it okay to do a weighted vest to do exercises until healed without free weights? Yeah, I think that's a great modification. As long as you stick to the principles, it feels good. It's a great. You got to be creative with our modifications, right? And people are going to have just all different types of stuff. Couple more. How are you guys doing? How are we all doing? You guys got time for a little bit more? We can do a longer Q&A afterwards. How are we doing? You guys hanging in there? Oh, we still have the gift. We still have the gift for everyone. For those that stuck around, I haven't forgotten about the gift. All right. Let's look at split squats. I love these. These are great exercise. Balance. She's strong, but we got to work on her balance. I'll answer that in a second, Audrey. Split squats are a lunge. It's the same thing. Static lunge, split squat, similar terminology. There's Teddy. All right. Lunge is a great exercise. Pam's doing it without even any weights or any load. Um, you want to make sure you guys have a well-rounded training. Yeah, she's getting down to the ground. She can, because she can. All right. You got really tight quads, you got knee issues, ankle issues. It's going to be hard for you to get all the way down to the ground. But split squats are great because it's just a great exercise. It's going to challenge balance, it's going to challenge stability. It's going to load the spine vertically upright. It's going to make sure your hips, your balance, or your hips are balanced with your glutes and your core is balanced with your back. And it's not always about doing heavy impact exercises. It's not always about doing box jumps and jump squats and skipping back and forth. Although I see the value and importance of that, don't get me wrong. But this stuff I feel is the baseline in which all those things should be built out of after that. All right. Lunge, split squat, great exercise, gives you good balance, checks all the boxes. One thing I would include in everyone's program if they're able to have enough health in their knee joint, hip joint to be able to do it. Last one. Yes, still very beneficial if you can't all go all the way down. Yes, mini lunge. It's a regression. Go as far as you can and build from there. All right. Side leg lifts for hip and femur to start. It's a great place to start. Make sure those side glute muscles are working. Make sure you're not kicking out in front, compensating through your hip flexor. Make sure the glute is maximally engaged. All right. How to prevent trips and falls. Yes, ankle footwork for sure. 100%. All right, one more exercise, guys. The farmer's carry. Looks the easiest. 40 pounds each hand. She's up to 45 now. 40 pounds each hand. Time for carry. It's more based on your current endurance. So let's say you can go 100 feet, stop at 80. And then 2 weeks, you might get up to 100. Pick a weight that I'd say you can go at least 100 feet. If you're gassing after like 10 feet, 15 feet, it's too heavy. You want to pick a weight that you can go for, I'd say, what did Pam do? About 40 seconds to a minute, I think is a good place to start. What weight to start with? 10 pounds each hand, making sure that you can maintain upright posture, integrity, shoulders back, back straight. You're not hunching over, you're not leaning, you're not arching backwards. It's all about maintaining the postural integrity with this one. But that is Pilates a good way to, yes, it's a great to build that foundation. But I saw someone post a study where low impact versus high impact. Low impact doesn't really do enough for the bones, but it's going to get you that foundation to then be able to do the heavier lifts. I do both. Anytime someone says, should I do this in weightlifting? I just say do both. Should I do yoga or weightlifting? Do both. Should I do Pilates and weightlifting? Do both. Just do both. All right. Any other questions about any of the exercises, guys? Any question about any of the exercises? This was the fun part. I just wanted to talk about the exercises all day long, but if we don't talk about research and all these other stuff, then we'll get criticized. But how many? We covered it a lot. We covered a lot. I'll send the replay out, and we'll be covering more. But push up. Can you do those if you have scoliosis? You gotta what I again, I don't want to just say, oh, you have to go see someone for every single response like that. If you can maintain alignment, if you're not getting pulled forward, if you're able to just maintain postural integrity, I'd say yes. But that's what I'd be watching for. Scoliosis wouldn't be a immediate disqualifier, but if it's forcing you to sink more into a curve and if it's causing pain, if you're just being thrown out of a what looks like a good alignment, I wouldn't do them. You got to get that checked. But I would say it should be a good one to help if you have enough strength within your spine to maintain integrity. Can you go over proper breathing techniques during exercise? Sure. Eccentrically on the way down, usually you want to breathe in. When you come up, breathe out. You want to hiss through, but not overexert. Overexert is too much pain or too much pressure. You want to be able to use your exhale as you come up. It helps engage your diaphragm, helps engage your pelvic floor. So your entire core is braced to protect your spine, to add even more tension through your core to give you more strength as you come up out of a squat, out of a lift, right? I also sometimes like doing, if I'm at the top doing a squat, for example, I'll breathe in. On the way down, I'll exhale. At the bottom, I'll breathe in again, and then exhale on the way up. Not just a where I'm letting my air out, I'm blowing my air through my lips to create more intra-abdominal pressure, but I'm not like overexerting. That's too much pressure. That could cause issues. Um, we'll have to do more videos about breathing technique. It is of utmost importance. How beneficial are wall push-ups? Good starting point. Good starting point. Breathing out on the way up. All right. All right. Make sure you breathe. And you want to do a forced exhale when you're coming out or up. So you go down into a push-up, breathe in. When you're at the bottom, breathe out. Use the breath to sync up with that contraction, give you more power through your core to assist in the ascent. Does that make sense? All right. That is it. We went over a lot of stuff. Thank you so much for everyone that has stuck through almost 3 hours, 2 hours and 45 minutes. Got any questions, everyone? Thank you so much to everyone who stayed around. We went over a lot. Was it helpful? Do people have better understanding of a starting point, what you need to look out for, what exercises to do? Did we, hopefully didn't, I don't think we got to everyone's questions, but did we answer a lot of stuff that was on people's minds? We'll be posting the replay. You can watch this again. So we have a free gift for everyone. It's just not ready yet. We have a little more time. Thank you, Audrey. Good to hear from you again. So, all these exercises that you guys saw, um, the free gift for everyone is we're going to be creating a full exercise library of every single exercise that you saw us show in picture or demonstration. And we're going to upload all these for free for everyone to access the correct form, the correct technique. We're not going to hold anything back in terms of the correct form and technique for foundational exercises, for how to do each exercise, to how to load. It's just going to be kind of trickled down slowly as we do things. It's just going to be a lot of work, but I think it's just necessary. And again, we don't want some very important information about exercise form or technique to be necessarily gate kept behind a paywall or anything like that. So for anyone that did stick around that wants uh, first access to the full exercise library, um, scan the QR code or go to that link. I'll send an email for everyone that can't click on the link right away. But we're gonna have anything that we think is appropriate to be able to share for free. We'd love to access a Facebook group. Yeah, balance and body restoration. There's a lot of stuff happening on that Facebook group. Way faster than I anticipated. You'll get to see me a couple of arguments with people and stuff. It's been quite fun. But yeah, so this is the only if you did find this helpful, just the only thing I ask is just you can share our information, share our contact. If you see our stuff on social, just spread the word, give us a share, give us a like. If you found it helpful, just spread the word to more people. That would be the the coolest thing for us to that's all we ask. We don't um need anything from anyone except to just get feedback from if you find our content useful, if it helps, if it helps just kind of give you guys some better direction. Because again, a lot of people I'd feel aren't giving the right direction right now. And I'm not to say that I have the right direction. It's just I have a perspective that I think is worth listening to just based on what I've seen. Okay. So last thing we will say, a lot of questions. Most important thing is if you're going to do any of this stuff, the most important first step is to get an assessment. I'll send it through the email. I'll send it because it won't be it's not even ready yet, but I'll make sure everyone assessment by who. Good question. I do not have all the answers. All I know is that people that have a certain certification called the SFMA, Selective Functional Movement Assessment. These are people that I learned how to assess the whole body from these people. A company called Functional Movement Systems is again, I'm not affiliated with them, so I'm not trying to pitch or promote anything about them. It's just I believe in their system. It's been the foundation for how I see and assess movement. It's allowed me to help our patients get over injuries and stuff like that. So if you're going to look for someone to give you a good assessment of your mobility, what's good, what you can and can't do, what you need work on, look for someone that is certified in SFMA. There will be a really good place to start in terms of can you move well before you move often. That is that company's tagline. I borrowed it from them, but they are people that I would definitely look for someone that has that certification. They would be a really good place to start with. In terms of strength and loading, again, we're still learning. We're still learning. And again, we'll be contributing what we know, our videos and stuff. So everyone, just please stay tuned. Keep up with us on social media, Facebook, Instagram, email. And just yeah, just keep supporting us, and that'll allow us to keep supporting you guys. Yeah, I mean, it's just I can give recommendations. It just depends on the location and whether or not we know of people in the vicinity. So, all right, last thing is last point of questions. We have a couple minutes left. does anyone have any burning questions that they want answered? And then we'll take off. Yeah, supplements, collagen. I just don't know enough about it. It's just that's not my. I can't answer that with any level of certainty or clarity. I just don't know. But thank you for the question. Are you afraid of liability? Yeah, I'm not doing virtual clients. I put very strict disclaimers on all of our videos. This is not advice. This is not for people to do. This is just an example of what can be done in a clinically supervised situation, right? Yeah, it's when I see stuff like again people jumping off of boxes with trap bars, I just feel that an ethical duty just to again, not, I don't want to call people out. It's just when I see that stuff, it's like people just aren't. This is just not an appropriate thing for people to be doing. Most people to be doing. It's cool that some people can. It's just and even just showing a kettlebell swing or a deadlift, it just has to be laden with all these disclaimers, because people just do stuff and it's there's no checks and balances. So, but the problem is if we show the basic stuff, if we show planks and bridges and the foundational stuff, nobody watches, and it does get any attention. It's only until we like say, oh, look at this woman who reversed osteoporosis. She's swinging kettlebells around. Do people actually start to pay attention and watch? So that's just the nature of social media and what people watch. It's not something that I really envisioned doing. I just posted stuff because I thought it was cool and I thought it was just interesting for people to just to see what's possible. Um, but no, it's something that we struggle with in terms of what to post, how to post it, make sure people don't take things out of context and people are saying, "Oh, that's not safe, that's not good." It's like, well, it depends. It can be. It's good for some and not for others. Again, I've only heard of Osteo Strong. I just don't know enough about it, but I've heard that yeah, some of their studies are a mess, but at least they're trying. They're trying to do stuff, I don't know enough about them as a company to really talk anything about them, good nor bad. I just don't know. All right. We have about a minute or so left. Last questions. Anything want to get in? Anyone want to get in? Do people have to fly to your clinic for assessments? We get one of the most common questions we get is, do we do virtual? And right now we do not. We just don't have the capacity for it. Again, just me, my wife, Austin and Teddy and I, and we're not there yet. If there's enough demand, if there's like a group option online, we may do something like that, but it's not something that's on our horizon anytime soon. We have our in clinic, that's our priority, and doing free content for people out there. Those are our top two priorities. And if virtual programs happen later on, then they may happen, but as of right now, no. Okay, everyone. Um, that is it for today. Give me 1 second. Say hi to everyone. Someone wanted to say hi. Here's Teddy. So our support. Here's Teddy. And here's Tree, everybody, helping us out. The stable rock behind the clinic. It's just us. It's just us. So again, everyone wanted to say hi. Thank you so much all for being here. It's really cool. It's, again, just didn't really have much expectation a couple weeks ago. I did not have a webinar or anything planned. So thank you all for joining. Thank you all for subscribing, asking questions, and thank you for all the support. We really appreciate it, and we will do our best to continue to just kind of give back and do more for everyone. So, all right, signing off. Thank you so much, everyone. Yeah, we'll consider it. We'll consider if there's enough demand. We just too much on my plate to because if I'm gonna do it, I'll do it right. It's not gonna be something that's rushed or something that's just thrown together. But if there's a high enough demand for it, if people want to do something like that, let us know. Just keep in contact with us. Let us know what you would want out of a hybrid program like that, where again, our priorities right now is to serve our our in-clinic patients and creating this exercise library for everyone to just understand how to do the exercises. I think that's a good place for people to start. And then as people start to do exercises, if they need help, guidance, more of a, ongoing support, then we may do something like that in the future. But things are new. We're just getting started too. This is just the beginning. So thank you all.
Terry just keep yawning.